Welcome to the House Health and Human Services and Elderly Affairs Committee, also known as the nicest committee in the House. We have an alumna with us, and Mary Freitas is sitting in for Representative McKay, and Representative Freitas and I sat next to each other my first year until they moved me because Representative Knirk and I kept poking each other. So welcome back. And also the other seat filler, please introduce yourself.
Representative Josh Query.
Okay, nice to have you here. And I don't think the fact that this mallet appeared suddenly at the head table is an indication we're having hard-shelled crabs for lunch. It just sort of showed up. So if anyone wants it, I don't know who it belongs to, but this is mine. Open the exec session on Bill 1022. We're not going to necessarily be taking them in numerical order. A few people have asked if we could hold a bill that is special to them until tomorrow, and I've so far been happy to accede to that. So we are actually going to start with the top of the list. 1022, permitting pharmacists to dispense the drug ivermectin by means of a standing order, and the chair recognizes Representative Cushman because there is an amendment.
Thank you, Mr. Chairman, and I'm passing the amendment around right now. It's 2022-0964. I got them for this way.
You got them this way?
Yep.
And I brought down many of the amendment groups from the fourth floor and just ask you not hand them out until the bill is called, or we're going to drown in paper more than we usually do.
So this amendment that's coming around, it does address some of the concerns that were raised in the work group on this bipartisan work group, although we could not reach a consensus in the work group after several meetings. But it addresses the concerns that were raised. So it indicates that they have to specify a screening protocol for each patient, a requirement to document the screening performed and the prescription in the patient's medical record, including a plan for referring for an evaluation and treatment if adverse events occur. It also removed the line that nothing on the information sheet shall discourage the use of ivermectin for the treatment of COVID-19, because if ivermectin is a versatile drug and it's got many uses, so if a physician and a pharmacy want to enter into a standing order agreement like this to make ivermectin available for treating parasites such as scabies and not specifically for COVID-19, then they shouldn't have to not discourage if they feel that that's in their interest.
How would the amendment differ from the bill as originally filed?
Yeah, so it's mostly in lines 11 and 12, just some slightly changed wording just to make it clear what needs to be included. Again, the screening performed and a plan for referring for evaluation and treatment of adverse events. And then also in paragraph sorry, looking for it. It also places the statements that the Board of Medicine shall not deny, revoke, or suspend or otherwise take disciplinary action against a physician based on a physician's failure to follow a standing order provided using the provisions of this section. Puts that into the statutes governing the Board of Medicine, and likewise with the advanced practice registered nurses and the pharmacists. It just puts those into the appropriate statutes as well, instead of having it only be listed in this pharmacy statute.
What line is that?
So it's actually the 3 new sections at the end. section 2, 3, and 4. And it also includes that the information sheet that they give out, so this is section 5 of the bill, starts on line 25. The pharmacist shall provide each recipient with an information sheet written in plain language, which shall include but is not limited to potential adverse effects, drug interactions, Food and Drug Administration approved indications for ivermectin use, the importance of follow-up care, and healthcare referral information. So really the important piece of that, I mean, it's all important, but something of note is the indications for ivermectin use, so they are informed that it's an off-label use.
Any questions for the representative? Representative Merchant.
Thank you, Mr. Chairman. Also, thank you, Representative Cushman, for taking the question or responding to it. I want to commend you for trying to make some changes to it. Unfortunately, I don't think it fits what we're trying to get to, at least from a pharmacist's point of view. A standing order is different than a collaborative agreement, the way this is written. An agreement is between a provider and a pharmacist, which spells out exactly what it is, which is what a collaborative agreement is all about. Standing order, on the other hand, is really authorization for the pharmacist to follow a protocol, and that's broadly used. So without having the underlying protocol that we all can agree to and vet it correctly, I don't know how we can use a standing order as a pharmacist. So therefore, we're trying to take a collaborative agreement approach and apply it to a standing order approach. And the two of them don't fundamentally work that way. So that's why when I look at this bill, overall, even though the drug may be safe, it still needs to have some sort of guidelines for the pharmacist to follow that have been vetted and built on consensus. So we did the same thing with nicotine, with hormonal contraceptive therapy. The process we went through to develop the protocol, plus the forms used to give to the patient, were fully vetted between all three disciplines. And it took time, but it was, at the end of the day, the appropriate thing to do. So without having that process in place to get to us through consensus, a protocol, an agreement upon what the standard form is going to say, I could not support this.
Question of the chair for the representative: if there were a tweak to the amendment that deals with the terminological problem, would that be sufficient for you?
No, it would not, Mr. Chairman. The reason for it being is the key to it is the protocol. Until we have an agreement amongst the professions, amongst the disciplines of what that protocol is, I think we're putting pharmacists into crosshairs with liability. Because if something happens, heaven forbid it does, and that protocol has not been vetted appropriately, then I think we're opening up the pharmacists to a lot of liability that they may not understand or may be pushed into taking, if you will, action which should not be in their best interest. And I still go back to the issue about the protocol.
Thank you. And since this is an exec session, it is not necessary to ask a question, not that we usually do anyway, but we definitely don't have to hear. Anyone with anything you wish to share or ask of the amendment sponsor? Representative Knirk.
Actually, mine is a question.
Good for
But just
you.
a little confused. On page 1 of the amendment, I'm sorry, of the, here we are, lines 29 to 31, let's say, talks about the Board of Medicine shall not blah, blah, blah. That's on page 1, 29 to 31. And then we have the new section over on page 2 that is lines 7 through 9. I'm trying to understand, why does that need to be in both places? Could you just clarify that for me?
Sure. So the statute that we're looking at is in the pharmacy statutes. So, and it's not specifically under, it's not specifically under like the licensing. So we just needed to put it in the nursing and the physician licensing statute. So there's no question.
Representative Merchant.
Thank you. The other thing which I'll bring to people's attention here about the issue of a standing order, when we have used standing orders in the past, what's included in there is a requirement for continuing education to be sure the pharmacist is educated appropriately to follow the protocol. That's not in here. And I think goes back to my initial concern is that we have a protocol that's really not been vetted correctly. And we also have not identified how the pharmacist should be trained to use the protocol. So those two things taken together, I think, makes this bill non-passable.
Representative Folsom.
I'm not really sure who would have the answer to this, but can't the protocols and the process of education be hammered out in the rules process?
Representative Merchant.
It could be. Unfortunately, there's no requirement for it to be done. So, right, so you can't do that unless the statute requires it, and at that point in time, the statute does not require it. If we went through rulemaking process and had the boards, like we did with the other standing orders, vet things appropriately, we could do that. But right now, that's not a requirement in this amendment nor in the bill.
Representative Weber.
Thank you. I'm going to take a step backwards and rather than wordsmithing, just say that we've already passed a bill that clarifies that off-label use is appropriate when a provider and a patient have had an appropriate conversation about the medicine and its use. We strengthened the protections for people using off-label use and clarified that they were very appropriate. So I think that's the way to go, and I'm absolutely opposed to this approach as a matter of policy. Thank you.
Representative Cushman.
Thank you, Mr. Chairman. So I have several points. So I understand what you're saying about a collaborative agreement, Representative Merchant, but that requires a prior relationship with the patient in all scenarios. This drug is available in many countries over the counter with no protocols required. It is incredibly safe. The patient could dose themselves how they see fit. So this would ensure that there's an agreement between a physician who's familiar with protocols that are effective for what they want to treat to issue that order and then give the prescribing authority to the pharmacist through dispensation, through his or her ability to dispense it. You know, this is something that is needed quickly. That's why I didn't leave it up to rules. Well, it was needed quickly, and we don't know what the fall is going to bring. And fortunately, the numbers have decreased significantly. But the problem with establishing relationship with these doctors ahead of time, and we've had this discussion, is that they're hard to find. As far as liability, that's up to the pharmacist. This doesn't require any pharmacy or pharmacist to enter into this kind of agreement. It just permits, if there is a small pharmacy somewhere in the state who wants to enter into this agreement with a physician who's familiar with the protocol and can write it and issue it, and they enter into this together, then whoever goes to that pharmacy can ask for the ivermectin and be given it.
Representative Leon.
Thank you, Mr. Chairman. I think what this ultimately comes down to is harm reduction. Right now, people are getting ivermectin from India, from Mexico, on spring break in the Dominican Republic, and also getting it from the pet store, the farm stores. People are seeking it out, and I would prefer that people have available ivermectin that's been manufactured in FDA-compliant, FDA-inspected facilities. I understand this doesn't meet all the same requirements that hormonal contraception, which is very dangerous, important but dangerous, and tobacco cessation and nicotine therapy that also has significantly higher risks. I understand it doesn't hit all those other metrics, but people are using it, using one that is adulterated with another substance because they're only looking for ivermectin and not the other things that are in the horse medicines is dangerous. And by doing this and allowing those select pharmacies and providers who do want to enter into this the opportunity to do so, so that FDA manufactured ivermectin is available, I believe is a benefit to our people, and that's why I'm supporting it.
Representative Woods.
Thank you. I'm troubled. We, as Representative Weber pointed out, we already have one bill that I think places it in the proper position of having the physician and the patient understand that this is an off-label use, and I think that's the appropriate place. I don't think the legislature should be practicing medicine, which is really basically what this is. We've done that before. You may recall that there was a loud hue and cry to have bone marrow transplants for breast cancer. Huge hue and cry. And this legislature went through the process of mandating that insurance companies cover it. Well, guess what? Within 6 months, it was found that it would be not only inappropriate, but perhaps dangerous. We don't want to go down that path. Another example, Laetrile, hue and cry about all of the kids that were being wasted because this government would not allow Laetrile. We're having to go to Mexico. Well, guess what? Turns out it was not as effective, and it was also dangerous. There's a hue and cry with COVID. I will not take the vaccine. It's not FDA approved. No, that's just emergency use. That is not fully FDA approved. Yeah, here we're trying to legislate something that circumvents that very process. I think that's the wrong approach. Giving a standing order gives it the imprimatur that this is really fully approved by the FDA. If you look on clinical trials, there are some that say it should be looked at. The recent articles in the Journal of American Medical Association, New England Journal of Medicine, say we need some study. It looks like it could be okay, but the studies we've done in those that have just been recently reported say it doesn't indicate that this is really the best medicine. So we have to be a little bit careful what we're doing of practicing medicine in this way. And for those reasons, I will have to vote against it.
The chair asks Representative Cushman to follow up on Representative Wood's. With that off-label bill that we've passed, does that make your bill not needed, in your opinion?
In my opinion, no, it doesn't. We still have patients who don't know where to find the doctors who will write the prescription for ivermectin. And if they know that there's a pharmacy that they can just go to, it makes it much easier for them than to go to it's more convenient than having to go and find this doctor and set up an appointment, but it's safer than going to the farm store.
Anyone else? Representative Merchant.
If I know that most pharmacies today, because of the politics behind this, will not stock the drug, therefore, even if we have a standing order and we pass this, the opportunity for a patient to go to a local pharmacy to obtain the medication, which is the intent behind this, becomes null and void. So, in essence, I go back to what Representative Weber said and also Representative Wood. I think the way to approach this, because both bills are going to come through the State House and through the Senate at about the same time, is to use the off-label use. At this point in time, for people to be aware of it, a pharmacist in the state of New Hampshire can dispense a medication from any licensed provider, licensed by a state in any state in this country. They can do it through telehealth. There's ways for them today to have access to ivermectin and use the system we have in place and not have it slow down. But getting this bill through in a standing order does not mean that the pharmacies and the pharmacists are going to dispense it, because most of them probably are not going to stock it.
Representative Knirk.
Thank you. And I wanted to just reflect a bit on what Representative Woods said. He gave a nice historical viewpoint of things, and I think that's helpful. But keeping it into the more recent time, I know that there were many comments made in this committee at various points about that there's this huge number of studies on ivermectin that shows it's effective. In my testimony, when I testified about this, I went over the issues of how we judge the quality of a study so we know whether or not a study is actually valid. And that is not an issue of censoring or not liking a point of view. It is simply the way we've done it now for the last few decades in terms of looking to see study design. I don't know if any of you took time to look at the couple of studies sent out by the New Hampshire Medical Society. It was under James Potter's name about 3 or 4 days ago. But that's an example of the big difference. The sponsor distributed at the time of the hearing a paper on 233,000 subjects. Sounds wonderful. It's a lot of people. But the way that people entered the study is they were invited to come in if they wished to do so and take the drug. So if they walked in and they said, hey, I'd like to do this, then they were given the drug. No randomization. If you look at the 2 articles that were sent by Potter, that's a standard, real proper study where you went to a database from one of them to draw up people who were under treatment. The other is everybody admitted to the hospital. They were invited to join the study, but then they were randomized using computer randomization. It's not even just a person assigning them. It's all computer number generated to make sure that it's a true randomized and prospective study. The study distributed at the time of the hearing is not. And if we look at the studies, because I've reviewed dozens of them, most of them are just very poor quality. Again, as I stressed, getting away from the politics of this country, the Cochrane Collaboration, which is an international consortium that I've relied on for good quality studies for decades, have also looked at it. And again, they don't find negative, but they simply don't find any supporting evidence from studies that are quality studies. And that's why there still are ongoing. So I agree that we should be not giving the imprimatur that this is actually an accepted treatment, because it isn't. And that's probably why people have a hard time finding doctors who will prescribe it, is because the majority of doctors follow the actual data with the best data we have. And that's an important thing that we continue to do. If somebody wishes to prescribe it off-label, again, we have that authority over under the other bill that we already passed, and I think that should be sufficient. And also online, I understand people can go to FLCCC online and go ahead and get information and get a prescription as well. So
Thank
I
you,
also oppose this.
Representative. I would remind us, we have 23 bills, and we are still debating the amendment on the first one. I would not wish to think we're being dilatory. If you have an original thought that has not been stated, I would encourage you to put your hand up. If you're going to rehash what has been said on both sides, we have 23 bills. Does anyone wish to speak further? Thank you. The chair calls on Representative Cushman to make a motion.
Thank you, Mr. Chairman. I move to pass Amendment 2022-0964H to House Bill 1022.
And a second. Okay, Representative Folsom. I have to ask if there's any further discussion. In which case, the chair calls on Representative Cushman for a further motion.
No, we have to vote.
We do, don't we? That wasn't being dilatory, that was just being stupid. Would the clerk please call the roll on Amendment 2022-0964H to House Bill 1022?
Representative Leon.
Yes.
Representative McMahon, sorry. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas.
No.
Representative Snow, absent. Representative Knirk.
Yes, I'm sorry, no.
I gotcha.
We already wrote it down.
Representative Query.
No.
Representative Cannon.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
No.
Representative Pearson.
Yes.
11-9.
The amendment carries 11-9. The chair now, hopefully, calls on Representative Cushman for a further motion.
Thank you, Mr. Chairman. I motion the bill as amended by Amendment 0964H be voted ought to pass.
And is it seconded? Representative DeLamus seconds it. I must ask if there's any further discussion. Seeing none, the clerk please call the roll on House Bill 1022 as amended by Amendment 2022-0964.
Representative Leon.
Yes.
Representative McMahon. Representative Acton. Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow absent. Representative Knirk.
No.
Representative Query.
No.
Representative Cannon.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
No.
Representative Pearson.
Yes.
11-9.
And Representative Cushman, if you have not already written the committee report, please do so. And I will, do we recognize Representative Merchant for that?
Representative Merchant appears to have volunteered. And we thank him.
And the qualified one to do so is a pharmacist. We've got to get this stuff in by noon on Wednesday. We have to. So please, I want those blurbs ASAP. This ends the exec session on House Bill 2022. Let me get all this stuff together. Uh, 10:22. Would you believe I just said that to see if people were paying attention? No. You're right. Now I am going to open the hearing on House Bill 1077. You have been sent a copy of the amendment by email, but here is hard copy now coming around to you. And I'll let you have a chance to look at it again. And for the record, under House Bill 1022, 412 people signed in support and 327 signed in opposition. And I'd remind people, in the opinion of many, these numbers are at least a bit squiffy. It has to do, and I say that about bills where way more people signed in for me than against me, because it just means somebody managed to get out the emailers. And if there's an amendment, remember, these sign in and sign in against are for the original bill, not the amended bill. So anyway, the chair recognizes himself to speak to his amendment. Our House committees are sometimes presented with a bill asking for something to be put into law. In response, we often hear someone say the bill is unnecessary because the subject is already covered in the law. And we can debate whether that's true or not, adequately speaking. But much of the time, I find myself in sympathy with those who just want to make sure whether the facts of whether it's covered in the law are there or not. I recognize that there's concern and maybe even fear. And for me, that's also a real thing. When conversion therapy was previously debated, no one could cite an example of a licensed professional in medicine or counseling using shock treatment or locking somebody in a closet or subjecting someone to pornography. But irrespective of that, the fact remains that some tender-aged people might be counseled, dare we say, pressured or forced to become something that is against their will even if it's the will of their parents. I understand the proper function of professional counseling is to be client-directed. So I honor the concern raised, as I honor the fear expressed. However, I also know of tender-aged persons who are experiencing same-sex attractions they do not wish to have and want professional help to work through those feelings. I've spoken with professionals who have told me they're afraid of having sanctions brought against them for offering services to this group of clients. Some have told me that their fear is unrealistic because the law doesn't read that way. Again, that's debatable. And whether this is true or not, I recognize the fear that is present here. For me, that fear is a real thing as well. So I wish to honor the fear, the concern. I wish to honor what I believe is the appropriate use of counseling, that it is client-centered, and that counseling is not forced on the client by professionals. In addition, this amendment says that across the board, professional services should be client-determined. And as I was working on this amendment, I wondered why the people who were mentioned were just those under 18. How about 19-year-olds? Should they not be free from having counseling forced on them? Or 20-year-olds? Should not adult clients also be able to have counseling, the intent of which comes from what this person wants? Shouldn't this be true straight across the board? No forced counseling and protections. So that is my amendment. And as chair, I will welcome any discussion or questions. Representative Merchant.
I want to commend you for taking the stab at doing this. However, I do concern myself against anyone's will, particularly a minor. I know growing up as a child, my parents were gospel. They were, you never questioned my family, my support system, and so forth. It wasn't because they were hard on me, just because their acceptance of me was so critical that whatever they were recommending that I should be doing is what I did. So even though it says against the will, I'm concerned about how independent that will really is when a parent is basically at that point in time saying to do something, even though they don't believe it or don't think they should do it. The reality is they're God. So therefore, I don't think we can actually put something that says against their will, because I don't think they have independent will.
At what age? To what age?
I'm 68 now, and I still look to my father, who's 90, and his opinion of me and what he has still carries tremendous amount of weight. So I don't think we ever leave that, Representative Pearson. I think we look to our parents with a whole different viewpoint, regardless of our age. More so when we're young, for sure. But even to this day, I look to my father, and his opinion means a lot to me.
Thank you. Representative Shapiro.
Yes, thank you, Mr. Chairman, and I would agree. I appreciate your efforts to change this to solve a problem that you see, even though you are clearly against any kind of coercive therapy. So I give you kudos for making this attempt. I would also not support this amendment for a variety of reasons. I was able to speak to Dr. Goodnow, who is chair of the Board of Mental Health, who informs me that there has never been a complaint since the statute came into being of someone inappropriately talking to a client about their questioning their sexual orientation or identity. It's just has never been brought to the board. So I would say that this is a problem. This is an attempt to fix a problem that really does not exist. I know we disagree about that, but my my long experience in the mental health field tells me that the problem of clinicians being fearful about talking to young people about their sexuality, about their discomfort, about their feelings that are not aligned with what they think they should be feeling. It's just, I don't believe that it's a problem. Therefore, I think there's no reason for this bill or for the amendment. I also would like to just speak a little bit to what Representative Merchant said, which is that I think there is just a power differential between adults and 15, 16, 17-year-olds. And sometimes we wish they would listen to us more, but in fact, they listen to us a lot. And I think that this bill, the way it's written, the amendment, the way it's written, would still allow a parent to choose who the therapist was, what kind of therapy the therapist practiced, what their biases might be, and send their child to that therapist. And I think, therefore, the problem. I would also say that in the last section where it talked about if the therapy in question is alleged to have consisted of speech only, the relevant licensing authority shall presume that the therapy was client directed. And I know you put in an less clause, but I would say that just in general, speech only therapy or talk therapy certainly can be coercive, can be pressured, and I don't think this is the kind of question we want to be litigated in each case in front of a licensing board. I think the licensing boards go by professional ethics, and they will take care of these kind of situations without this bill. So for all those reasons, I would vote against the amendment as well as against the bill.
In response, Representative, if somebody now of any age, but especially tender age, is dropped off at a therapist with the words, "Fix him," and that is the charge to the therapist, I want the fear of that client yelping loudly to be honored, just as I want those therapists who have told me they're running scared in the other direction. I want to honor the fear, even if it's not necessary in law. I want to honor both sides. Representative Snow.
Thank you. I do apologize for the entirety of unforeseen problem existed at home.
Understood, Representative. You are the keeper, Mary, of the microphone and the on-off switch. It's a coveted position, which is why we brought you in today.
Having only read I did get to see your amendment ahead of time, so I did know. Yeah, put it up right. So I do know a little more about it. I just want to make one other point that he didn't make, and I do have a letter here from the National Association of Social Workers that confirms that there has never been a problem in that particular area, and that no social worker that anyone knows of, that if they had a circumstance like that when someone was dropped off, I personally would not have a problem seeing that youngster, as long as I didn't make a promise to him that there's something I could do to convert his sexual identity. That's the only thing that's out, but certainly to deal with the feelings that he's had. When you talked about the desperation, there's absolutely no prohibition to any of us from doing that. And I would just also like to point out one other thing. Knowing yourself, and you do sometimes see people like this, and I know you as a person, and I know you as an approach, would be the most gentle person in the world about how you handle this. But also when you talk with some of these professional organizations, even the most gentle approach is totally ineffective in making the change. And secondly, even the very gentle approach does tend to foster feelings of guilt, shame, and social isolation, even done in that form. And obviously when you get up to the more coercive methods, you get into some very dangerous situations, even cruel and perverse. And I think to ban this is absolutely necessary. I would like to see it banned, not just for licensed professionals, but for anyone, any self-appointed life coach, sexual identity counselor that called himself that if they engage in this, that they ought to be banned too. But I don't know how to go about doing that, and that's not included in this bill. But I would have to oppose the amendment, only because I really feel that more harm than help can be done, even though I know your intention is to do the right thing. I'm sorry, Mr. Chair.
Anyone else? Representative Leon.
Thank you, Mr. Chairman. I am a new member on the New Hampshire Council to Prevent Suicides, and I actually sat in on one of the data meetings, and they were going through some of the data that they had from the Youth Risk Behavior Survey. It doesn't have trans as an identity on there. They had straight, gay, bisexual, not sure, and there were people who didn't answer. What was really terrifying looking at it was that the not sure and the bisexual had so much more of an increased risk of suicidal ideation and suicide attempts. There was a large group of individuals who aren't sure how to categorize themselves. I don't know if that's because trans was left off of the survey, which may be the reason, because if your answer is not there, you're going to say not sure. That's a good test taker. But the reason why I was working to try and find a way where people can go in and have a safe place where they can discuss how they feel, and the practitioner doesn't feel that they have to only have affirmative counseling for the therapy, that they can explore it with somebody who might not be sure. They might not be ready to make that move, or maybe they don't want to. But to remove that language that says only affirmative therapy, because I don't know how it's going to impact each individual. I do know that counseling against somebody's will, directive therapy, is immoral and unethical. I just want to make sure that we have those protected places, because these kids are attempting suicide at a much higher rate. And I don't want to take any opportunity for them to get counseling to express their feelings and determine who they are. Not be told who they are, but determine who they are themselves. And hearing from counselors who are afraid to see minors because of this law means that our shortage of mental health professionals is even worse. And I believe ethics will keep any of these coercive things out, and that's why I want to make sure we increase access.
Representative Cushman.
Thank you, Mr. Chairman. I would just like to follow up on what Representative Leon was saying. Not only ethics, but I think also liability is a huge motivator to stay away from coercive therapy. And it's pretty clear in this that any therapy that is coercive in nature, that is not in the interest of what direction the patient would like the therapy to go, is entering into dangerous territory for a therapist, and that's a great deterrent. And it's not about what the parents want. You know, most therapy sessions are a half hour to an hour long with the patient privately. And if there is a teenager in there who wants to explore their sexual orientation or gender identity, this ensures that they can do that, and that more therapists will be willing to have the conversations, and you know, they won't be concerned that they're going to face disciplinary action just for having those conversations. So we need this bill.
Representative Woods.
Thank you. Just in terms of the word affirmative, I didn't think of it in the terms of being affirmative for a particular end point. I interpret affirmative meaning supportive of the individual,
So do I.
regardless of what their discussion may be. I want this, I want that, or I'm not sure. Supportive, and I interpret the word affirmative in that vein.
So would I, sir. Representative Shapiro.
Yes, thank you, Mr. Chairman. I would just want to acknowledge that it was a failure on the part of people who wanted to defeat this bill to not have clinicians come and testify on the other side. I think there were 2 psychologists and a psychiatrist who testified that this was, that they were intimidated by this law and would therefore not talk to adolescents about their sexuality. I acknowledge that they were here. I acknowledge that people were not here on the other side. I don't know how to convince you of this, but my absolute belief is that they are outliers, and that if people had known and people had organized around this conversion therapy ban being in danger, that you would have had many, many more clinicians. And maybe that has to wait till it gets to the Senate if it somehow makes it through the House. But once again, I would just say that I think this is an attempt to fix a problem that absolutely does not exist.
I spoke with 2 counselors who are not in the room, who agreed with those who were in the room. So that only makes it 5 to no-shows. But still, it wasn't just the 3. Representative Cannon.
Thank you, Mr. Chair. Excuse me. When the original bill was first brought forward, the language that was submitted for a statute was identically used in a number of other states and still is in place. And the challenge that we were faced with is recognizing that there were a number of youth who were already had difficulty with conversion therapy, and many had taken their life because of it. Even myself, not having a supportive home back in the 60s that I could even think about coming out, as well as a church that thought I was an abomination, forced me into the closet with a lot of pain. When we brought the original bill forward, we didn't include people over the age of 18 because they have the right to decide for themselves already as adults. And so we did not include that because they have the right to do whatever they want to do, where a child is under the protection of their parents or their legal guardians. I really appreciate your efforts to improve this bill, but I'm afraid that I'm not going to be able to support it.
Thank you.
Amendment.
Anyone who hasn't spoken yet before we go to round 2? Representative Snow.
I would just like to point out in response to what Representative Leon said, it is true that people that are going through this struggle are at a much higher risk of suicide. But I've also read articles to show that people who are going through this struggle and engage in this kind of treatment are even higher. The rate, it tends to promote that thinking even further rather than reduce it. And that's the scary part for me.
Representative Query.
Thank you. I just want to follow up on what Representative Snow just said. This is a hard debate. I grew up in rural Midwest, and this is something that I grew up with a lot of friends being put through this, whether it was through personal counseling of, licensed therapists or church sanctioned groups that would try to help this. And to just further on the fact that kids follow what their parents say. They want to make their parents proud. And when they go into these conversion therapies and they are continuing to have the same feelings, the same-sex feelings that they are there to get rid of, they are only seeing themselves as more failures to their parents. They are only making themselves realize that there's no way out for them, which is leading them closer and closer to making that decision. This is an ongoing crisis for the LGBTQ community. As we see bills like this rolling back, protections for us to live our lives, it brings even the most secure and out people to the edge of making those decisions.
We are speaking to the amendment, Representative.
In that case, I will cut it there, but I will just say I am against this amendment, and the underlying bill.
Representative King.
All right, I'm sitting here a little confused, and if you know me well, that's not unusual. So, I know when this bill originally came, it just flat out said repeal the original the law that's currently in place, and I don't think there was a single member on this committee that agreed with conversion therapy. Just to be square on this. And so what the chairman has done is gone back and tried to define what conversion therapy is, because we had people here at the hearing that said they were confused as well, and that they needed boundaries on where they could be in their therapy. And I think that what this amendment's trying to do is to outline those boundaries. Am I mistaken?
That was my intent. Representative Knurk.
Just a quick thing, I think the original, the statute as it stands does do those boundaries. And for example, it says conversion therapy shall not include, so on and so on, identity exploration. So it is not something where one has to use affirming in Representative Leon's thing, but more in Representative Wood's. It does give those boundaries. We're taking away those boundaries with this amendment.
Representative Merchant.
Thank you, Mr. Chairman. Has this amendment, we talked about the 5 therapists that came and spoke
Well,
about
3 and 2 I found later.
3 and 2 and
Yeah.
3 and 2, which that's, I think goes back to 5. In regards to this issue, because without them looking at this amendment and understanding it from their viewpoint, is this going to fix their objections to the bill to begin with?
All 5 have
They-
read this amendment while it was being crafted.
And
One
they all-
made a suggestion. All 5 have read it as you see it. And
Thank
they
you.
believe, yes, it will deal with their fears
Thank you.
in a way that the original law on the books does not.
Thank you.
Yes. Seeing nothing further, the chair recognizes himself to move Amendment 0921 and looks for a second. Representative Lay on. And having discussed it and seeing no more hands, would the clerk please call the roll on Amendment 0921 to House Bill 1077?
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey. Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow. Representative Knurk.
No.
Representative Query. Representative Cannon. Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
No.
Representative Pearson.
Yes.
1110.
1110, the amendment passes. The chair recognizes himself for a motion, and the motion is ought to pass as amended by 0921. And looking for a second, Representative Kofalt. Now further discussion. Representative Corey, if you wish to continue, you may. From when you cut off. You can wave off if you wish.
Yeah. As I was saying, I think the purpose of this bill, I can hear and understand. I wasn't here in the room. I was watching online when this bill was originally heard. Is all about the therapists and not the people who are being put in that therapy. I respect looking and getting the having the therapists and counselors and all of them give feedback on the amendment and therefore the bill. However, I would love to know how many people in the LGBTQ plus community you look to and ask for their feedback on this?
The question of the chair, I have not asked anyone because the numbers of emails I've got from those individuals you just delineated was considerable. I didn't need to ask for any more. I had several write me individually. Representative Weber.
Thank you, Mr. Chairman, and I just wanted to state that I certainly appreciate the amendment. I appreciate the concern behind the amendment. I really appreciate the removal of the 18-year-old line, although I agree with Representative Cannon that people who are over the age of 18 may make their own decisions, and therefore they are under a less coercive situation than they would be if they were a minor. I just think that the drafting of the language on page 2 is really opening a whole set of other cans of worms, and I don't see the reason to change. That having been said, I think we're better off with the original statute, and that is certainly the advice that I have gotten from the many people of the affected communities who have written to me and said they want to keep the original statute, and that was as an affirmative statement. So that's how I will be voting. Thank you.
The reason for the paragraphs 3 and 4 was because of lines 1 and 2 on page 2. Unprofessional conduct and shall be subject to such discipline as the relevant licensing authority deems appropriate. Well, if you're going to sue me, you're going to take my license away, we've got to have some definitions here. And 3 and 4 is akin to items that I have seen in other laws that follow the statements of lines 1 and 2. Anyone else? Representative Cannon.
Thank you, Mr. Chair. This may shock a few folks, but as I've read through your amendment, as it applies to the bill that's in front of us, where it does not force a repeal of the existing statute, it does improve the statute for a number of folks. And as such, I will be supporting a bill with this amendment. Thank you.
Thank you. Seeing nothing further, Representative Snow.
I hope this does not sound like sour grapes.
Oh, Representative Freitas to the rescue. Thank you.
Yes, thank you very much. I don't know why I have much problems with microphones. I know this may sound a lot like sour grape, but what we're doing is enabling a bill to come into effect.
That's surprising.
To make it more possible for people to get a treatment technique that clearly does not work.
Language about the preponderance of evidence? No.
If the words are against the individual's will and the individual doesn't want treatment, the individual knows doesn't work, I think we've got an out. Seeing nothing further, the motion before us is House Bill 1077 as amended by 0921H. The number of people who signed up in support of the original bill was 104 and against 1,083 for the original bill. But we're not voting on that. We're voting on as amended 0921 as moved by the chair and is seconded by Representative Kofold. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey. Representative King.
Yes.
Representative Kofold.
Yes.
Representative DeLamus. Representative Weber,
No.
Representative Freitas. No. Representative Snow.
No.
Representative Knirk.
No.
Representative Query.
No.
Representative Cannon.
Yes.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
13-8.
The bill passes as amended 13 to 8, and the chair, taking a privilege,
Yes, it adds up to
13.
21.
I purposely
8.
was really careful this time.
It was all the Republicans plus 2 Democrats, which is 13.
the chair wishes to continue. If we find this doesn't work as intended, or even if this could be improved, please make me your first phone call. Thank you. This ends the hearing on House Bill
we need minority
1077. I'll take care of the blurb, and who will be writing the minority?
We'll discuss it.
I'm sorry?
We'll discuss it and let you know.
You'll discuss it and let me know.
Can you let me know before we leave today? Because I have to turn the
Yes.
form in. Thank you.
Thank you. All right.
Representative Shapiro has volunteered.
Okay.
Thank you.
Now, open the hearing on House Bill, the executive session on House Bill 1045, and hard copies of the amendment are going around. 1045. And while I think of it, the original bill, not amended, 520 people signed in for it and 123 signed in against it. And yet, a funny thing happened on the way to the amendment. The prime sponsor of the bill, sitting at that very table, uttered a phrase, "I have now given up for Lent." This is only housekeeping. At which point, the bill's prime sponsors, dear friends, proceeded to rip the housekeeping amendment into small pieces, which was a wonderful thing. Thank you. Because it made the prime sponsor go back and look at things afresh and anew and place a call to Commissioner Shibonet saying, while I'm up, how can I help? And the commissioner said, well, if I can do a Nova Scotia accent, probably not. The Ethics Advisory Committee, as constituted in law, has wonderful people in it, but most of them aren't trained in ethics. I have groups of people who speak to me economically, politically, people representing various special interest groups, but I need an ethics committee comprised of people trained in ethics. At which point, I got to meet some fascinating people in the realms of law and medicine and psychology and all of that, who said, what a wonderful idea. Let's have the Ethics Advisory Committee be made up of various people who have studied to some good degree or other the field of ethics. Now, ethics isn't exactly the same from profession to profession, but there's a lot of overlap. The Venn diagram shows a lot of commonality in how to think on an issue ethically. So the members of the committee, as delineated in the amendment, were run by the commissioner who will benefit from this committee, and she has given her imprimatur to this list. So, the original prime sponsor is very grateful for the funny journey that led us to this point and wishes to move the amendment 902H and is looking for a second. Is that a second, Representative Woods?
Yes.
Thank you, sir. Now let's discuss. So once again, guys, thanks for shooting down the original.
Sometimes we do allow an engine rebuild.
Seeing, hearing, nothing. The motion before us is actually the Amendment 902 to House Bill 1045 as moved by the chair and seconded by Representative Woods. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Yes. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow. Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21 to 0.
Chair recognizes himself for a further motion, and the motion is ought to pass on House Bill 1045 as amended by 2022-0902H. The chair moves, and someone, Representative Woods, once again seconds. Any further discussion? Then the clerk, please, may call the roll.
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Yes. Representative Cushman. Yes. Representative Folsom, yes. Representative Kelsey. Yes. Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Yes. Representative Snow. Yes. Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21 to 0. Consent.
Consent? Wow.
Yes.
I already wrote the blurb. Since the hearing on House Bill 1045, the exec session on 1045. Now open the exec session on House Bill 1439 relative to hospital visitation policies. Prime sponsor was Representative Rice, and we have actually two amendments. And if they have not been passed out yet, they may be at this time. Representative Weber's Amendment 946, Representative Leon, Cushman, Rice, and Kelsey 953. And okay, the Weber one is coming around. And where's yours? Oh, okay. 1039 is not in anyone's possession at the moment. Do I have a staff member here? I do not.
Yes. Yes, she's here.
You just said 1039. Do you mean 1439?
1439.
1439, excuse me.
Okay.
Yes,
Right,
and
but
it's being
there's a
passed
second amendment.
around. And you said I do have a staff member here?
Yeah, I think Susan just.
What about the Leon amendment? Because we do not have that.
We're checking into why that hasn't showed up yet.
Oh, okay.
Yes.
Do I have a staff member in this room?
We need to get them passed out to the entire committee. There is another amendment. Well, I got a set, and somebody else may have gotten a set.
Yeah.
They printed the wrong one for me.
Okay, yeah. So it'll take a moment.
So is the issue we don't have the other amendment?
No, we have it, that House Committee Services printed yours and not mine for me when I sent.
We need to.
I need to not have a migraine, that helps too.
It can be such a headache.
Does she have one she's running?
She's making copies now in the next room. And by the way, we don't meet here tomorrow. I don't remember where we are, but it was in the notice that was handed out. Wait a minute. I do. No, I don't. I thought I did. Do I? We will be meeting tomorrow in rooms 2013. Apparently, Finance wants its room back tomorrow. We sent them so much stuff. So please read over the Weber amendment because the Leon amendment will be forthcoming.
Here's your original.
Thank you. Okay, we've got an amendment coming from Representative Leon. And for the record, signing in on behalf of, in favor of this original bill, 109 people. Signing in against the original bill, 4. How about?
Looks like everybody's.
Give you about a minute more, and then we're going to ask both Representative Weber and Representative Leon to explain their amendments.
I only made 22 copies.
Well, my amendment is 2022-0946H. And what I did was I took a significant amount, but not all, of the original bill, and I placed it into the patient's Bill of Rights as an addition to the end of the patient's Bill of Rights. In doing so, I kept all 4 of the pieces in the original bill that the visitation policies might be limited or restricted when the presence of visitors would be medically or therapeutically contraindicated in the best clinical judgment of healthcare professionals. That is not in the Leon amendment, but I think maybe I should just talk to mine and then we'll discuss among ourselves afterwards. The other issue that the other things that we changed was that the healthcare facility is going to do its own drafting and posting of policies rather than requiring that from the department. And I just changed the wording on lines 5 to 9 because when inserting it in the patient's Bill of Rights, I changed it to sort of track as far as I could the existing language in the patient's Bill of Rights about the patient shall have the right to. So that's slightly redrafted, and I put minors and adults in the same paragraph. So those are the changes that I made. But I want to point out that in keeping the original language, I kept the language which has, I believe, been approved in other places. So thank you.
Thank you. Representative Leon, on your amendment, which is 0953.
Thank you, Mr. Chairman, and thank you, Representative Weber, for doing most of the lifting for me. As you pointed out, our amendment removes the line that says, oops, I'm reading it from yours here. The presence of visitors would be medically or therapeutically contraindicated in the best clinical judgment of healthcare professionals, because there was a lot of concern that that would just allow just a straight out veto from some of the doctors in one of these scenarios. In order to recognize that in some scenarios and some time frames, there may be a need to further limit visitors, we added the word written to what's line 20 on our amendment. So visitors are non-compliant with written hospital policy. That would allow the hospitals to make clear what they need to do in terms of their visitation for reimbursement from the federal government, because they have a certain protocol, because hospitalizations are over a certain rate. It would allow them to have the flexibility so long as they make that available to patients, prospective patients, and their loved ones. This is trying to honor transparency and say that the hospitals, so long as they share their plans, may make the decisions that are best for the practice of medicine in their hospital. So we believe that that allowed us to balance the rights of the patients, the needs of the hospital, and all of the different stakeholders by just requiring those to be written in that policy. So that is the main difference there.
Representative Weber.
The other main difference is that my amendment moves the policy to the patient's Bill of Rights, because these are talking about the rights of the patient, whereas the Leon amendment, I believe, keeps this as part of the licensing statute rather than moving it to the patient's Bill of Rights.
Yes, it does. Thank
Please
you.
respond.
Sorry, I apologize. And if you look on page 2, lines 18 through 20, we actually make that same new number, Roman 22, and we simply reference to that statute in the licensing, which says the patient shall be entitled to have visitors pursuant to RSA 151(2)J, so that that's not all gumming up the works within the patient Bill of Rights. But I appreciate that putting it in the Bill of, that is lines 18 through 20 on page 2 of the amendment. But I appreciate that having that information there. I see both arguments of leaving it in the facilities licensing or in putting it fully in patients in the Patient Bill of Rights. We just wanted to make sure that the hospitals knew that they needed to write that policy and make it available. And that's why we remained with it in the original section and just linked it back with that new paragraph in Section 3, page 2, lines 18 through 20.
Follow-up, Representative Shapiro?
Thank you. Representative Leon, this is just a clarification. Are you saying that the line that's in Representative Weber's amendment about visitors could be restricted if medically or therapeutically contraindicated is really included in your letter C, as long as it was in the written hospital policy, that it?
If that was the hospital policy, if it's in their written policy, then yes. But we want to have them have a written policy.
But could that policy be changing policy, based on, like, for example, a surge of COVID? Or does it have to be
It's a written
it-
policy, one that's made available to patients and prospective patients.
Okay.
I think that I can't imagine they'd be updating it hour by hour, even
Right.
day by day. But as situations change, as they ebb and flow, they'll be able to be clear with the community that they serve about how they're approaching the current situation.
Thank you.
Representative Weber?
I just want to be clear that without the language about the presence of visitors would be medically or therapeutically contraindicated, then I think that a hospital that denies visitation on that basis is very much at risk. And this is in their licensing statute, so they are at risk of losing their license. So that's item number 1. I would also point out, with respect to item number the issue of incorporating it by reference into the patient's Bill of Rights. There are lots of places where the patient's Bill of Rights is tacked to the wall or printed on a card and handed to a patient. And handing them something that says, nothing in this section shall supersede the right of a patient who is terminally ill to have visitors pursuant to RSA 151:21 XVIII. I whip out my computer and I have a direct link to the statute, so I would look that up. But I think most patients wouldn't, and I think they would be comforted by having words. But my real concern is the location and the lack of the other language. And I want to thank everybody on the subcommittee who worked very hard, because we are all concerned about patients having the appropriate support at a really difficult time. But we just were unable to agree on the way to go about it. So hence the dueling
Representative
amendments.
Leon
Thank
wishes
you.
to respond?
Thank you, Mr. Chairman, and thank you, Representative Weber. If you look at the lines just below that, that would be the section going into the Patient Bill of Rights. It would be line 20, which would be Roman 22, saying the patient shall be entitled to have visitors pursuant to RSA 151(2)J. The one that you pointed out, Roman
Sorry.
9, is the one that makes sure that this doesn't limit that end-of-life care. And I do want to thank you and everybody else on the subcommittee, too. I think it's quite impressive how close we are on these two dueling amendments, and I view that as a success in the process and collaboration.
Representative
I thank you
Knirk?
for the
Yes, just a clarification. I think Representative Leon said that if we look at the original bill, lines 14 and 15, the presence of visitors would be medically or therapeutically contraindicated and so on, that would be subsumed by point C on line 20 in the amendment. But
Which amendment?
Oh, sorry, her amendment, Representative Leon's
They're both
amendment.
her.
No, you got a point there. Representative Leon's
Thank
amendment.
you.
Line 20 says visitors are non-compliant with written hospital policy.
Right. Yes, the point is that's speaking of a visitor not being compliant, not that they would have a policy against a specific visitation in a certain setting. You'd want to have it say visitation is not compliant with hospital policy. This says a visitor. So that would be a person who says, I'm not going to wear a mask when it's required. So I don't think that the section A on the original bill is subsumed into C on the amendment. Because I think it's referring to a person, not to a policy, when we say visitor, not visitation. That's just my own personal interpretation.
Representative Merchant.
I am totally 100% confused. So when I'm looking through these two amendments, they both seem to indicate the patient's bill of rights, but this sounds like it's more about the visitor's rights. So are we talking about the visitor's rights, or are we talking about the patient's rights? Because I'm really confused between the two, which one we're actually talking about.
Do you want to?
Representative Weber.
Okay, well, I'll take the first stab at it.
You were called on first.
It came to us as more on the side of visitors' rights, and a number of people commented that this was really a patient right rather than a visitor's right. So the language may be a little bit skewed towards visitors' rights, but the thing that we were trying to do, but the language in both cases says that the minor is entitled to, or the adult is entitled to. So it is a patient right. The differences are, and these I believe, and Representative Leon may correct me if I am wrong, in the Weber amendment, we have retained specifically that the presence of visitors would be medically or therapeutically contraindicated in the best clinical judge of healthcare professionals. This is line 10 and 11 of the Weber amendment, and it does not appear in the Leon amendment because that was one of the things we were having difficulty agreeing on. I don't believe that that can be added to a hospital policy in the absence of our authorization, or if it is added in the absence of our authorization, the hospital policy as a whole could be challenged because that isn't in there. The thing that all of us struggled with in our discussions was to balance the rights of patient A to have the appropriate support and comfort of their loved ones or their chosen people, and the right of patient B to have as least unsafe an environment as we know how to provide them. Those are competing in many cases in a time of pandemic and under other conditions as well. And I think that we all wanted to get to a point where, you know, obviously, no, people aren't showing up in the emergency in the operating room and demanding to be there. It makes no sense. But to have people have appropriate support on the one hand and appropriately safe care on the other hand. The difference between the way we did it, aside from that one line, was that my amendment puts it in the patient's Bill of Rights, which is where something that is a patient's right ought to go, and which Representative Leon's also does, only incorporating it by reference, which I don't think is as useful as seeing the actual words. But Representative Leon's has it in the actual hospital licensing statute rather than, as well as by reference in the patient's Bill of Rights. And that means that the hospitals are at far greater risk, particularly without the protections of the line that I insisted be in mine, when it comes to licensing, as to whether they have complied with the licensing statute or not.
Chair asked Paula Minahan to come to the table, please, because she just might know a few things about hospitals.
Thank you, Representative. Paula Minahan, Hospital Association. So is there a particular question? So regarding the patient Bill of Rights, it makes more sense to us that it be in the patient Bill of Rights, and this did come up during the work session, that we believe it should be, the focus should be on the patient. So I do agree with Representative Weber, and we actually are fine with that, with Representative Weber's amendment, moving it into the Patient Bill of Rights. It is always a challenge when you can appreciate. So that's why it just makes much more sense to focus on the patient. The what I believe is, I'm just seeing the Leon amendment now, but by taking out the A in the original bill relative to the therapeutic, medically and therapeutic indications, that is a non-starter for us. That makes it a really, really problematic bill, and we have testified to that and have stated that our members are very concerned about any removal of that.
Representative Leon for a response.
Thank you, Mr. Chairman. My question would be, I guess what I'm trying to figure out is I'm looking at this and saying that the visitors would be the ones that would be asked not to be in the room or not be in the facility if it was medically or therapeutically contraindicated. And if the visitors are the ones who are having the behavior modified, then it would be a matter of the visitors being compliant or non-compliant with the written hospital policy. There's been so much confusion and so much stress for patients and their loved ones to understand what they actually can do, when they can be in a room, and when they can't be in the room, and people who are missing the end of somebody's life because they declined faster than it was expected, that knowing that it's not just about them and whether or not the staff likes them, but knowing what the policy is would be really comforting for a lot of these families who are going through a lot of trauma. And I respect that the hospitals and the medical professionals are as well, but this is trying to balance these needs. And
So currently the hospital's policies are on their website, as my testimony had indicated, and if you go on the hospital's websites, they are on there. This is about establishing the policies, and they are done with very careful consideration by clinicians, and depending on what the circumstances are. Forget about COVID. We may have an Ebola outbreak, which we had at one point. We may have a flu outbreak. They need to, and I think there was a comment made that they don't change their policies every hour, but I had one hospital indicate they changed their policies twice in 1 week. That is a lot. They have to go through a very extensive process for determining their policies, again, with the clinicians and those that are infectious disease specialists. So that is very concerning to us to remove that language. And I am concerned that this will just cause more confusion, honestly. We don't have a state law now. The hospitals are trying to be as clear as possible for the patient, for the visitors, but you're saying about getting into the room, they may not even be able to be allowed in the hospital depending on the situation. Fortunately, things are much better now, but during the surge, they were struggling with patients spilling out of their ICUs, and they had no space. So it's very troubling to remove that language. I think it's going to actually cause more problems if we don't have that language in there.
Do you wish a follow-up? If you wish.
Okay. No, I think I'll let other people
Okay.
ask questions. Thank you.
Representative Cushman.
Thank you, Mr. Chairman. I don't have a question. I have
It's okay.
a statement. At the end of the day, we need to protect the rights of the patients, and if the hospital can't make those available in writing and need to revoke rights on a whim, it's not acceptable. We need to put this through so that we ensure that patients have the right to have a caregiver, a designee, one person that can be there with them while they're receiving care. And I am frankly fatigued by the excuses from the New Hampshire Hospital Association that that is not possible and that you need flexibility to keep family members out. I'm sorry, but when people are in the hospital and they need care, they need their support people with them, and this allows for PPE to be used. There are plenty of mitigation methods to use, but one visitor in the hospital with a family member who is probably in one of the worst situations of their life is something that they all need.
And Representative Weber's amendment does address that, and I think we're going to agree to disagree relative to how hospitals have allowed for caregivers to be with their loved ones, and they have been making accommodations, certainly when there's been end of life, and it's just, we've been in an extraordinary circumstance for the last 2 years. So I think we have the hospitals have attempted to be accommodating. It's just, there are certain situations that need to be considered.
Representative Woods.
Yeah, thank you. Just looking at this overall picture, I'm really in favor of putting this into the patient education. That's where it's going to be most visible. And part of this whole process is education. If it's put in there in the patient's Bill of Rights, they get that during a time of admission, or it can be a flyer on the floor.
Right.
But I appreciate that it is referenced in Representative Leon's bill, but that's not, as has been stated, it's not going to be something that they're going to be easily referenced. So I think that's very important. Secondly, I too feel that the medically and therapeutically contraindicated is absolutely critical. There has to be a captain of the ship. And it can't be one family coming in and say, I want this, and this is my right, and the next patient is coming in and say, well, I want this right. There has to be somebody in charge. And that's one of the social responsibilities of physicians. We accept that responsibility. What I'm hearing is we don't trust physicians, and we only trust written policy. I understand there's going to be some bad decisions, absolutely. But I think we have to understand, too, that if we let the public decide how this is going to occur, there's going to be some bad decisions, too. I think I'm just harking back. There has to be a captain of the ship. And we have to decide who we want that to be. Yes, there has to be some baseline policies, but trust me, you can't, when you go to the emergency room, you can't look at a hospital policy about what you're going to do. You have to act, and that's what we're charged to do. I think keeping that line in about medically and therapeutically contraindicated is, to me, from my perspective as a physician, absolutely critical.
Representative Merchant.
Thank you, Mr. Chairman. I see merits in both of these amendments. I do see the logic of putting in the patient Bill of Rights. We're talking about the patient, not the visitor. However, I do understand with you have a, quote, written hospital policy, there's nothing to preclude the policy from including the presence of visitors would be medically and therapeutically contraindicated. That could go into the written policy of the hospital. Quite frankly, I think that gives the hospitals a lot of credibility and a lot of flexibility in what they want to do with their policy based upon their needs versus the state telling them how to run the facility. So I do think that there's merits in both. As I mentioned, one has a place which is a patient Bill of Rights. So we're talking about the patient, not the facility. So if we're really focused on the patient, I think it should go in the patient's Bill of Rights. If we're allowing the hospital to have the flexibility to define their policy, which is written, it allows them at that point in time to include pretty much in that written policy however they want to run their facility. So I'm looking at the two of them and saying, I wish I could have something between the two. I can't.
The chair wishes to interject at this point and say that this is Monday, and we're also meeting tomorrow. You know me, I love to square circles whenever I find them. And I don't know if it's possible, but if it's possible to meld the Leon and Weber amendment, is there sympathy for that?
Could I just clarify, Mr. Chairman?
Yes.
My amendment allows the hospital to have the policy. My amendment authorizes the hospital to include in the policy the considerations about presence of visitors being medically or therapeutically contraindicated. The Leon Amendment also allows the hospital to have their own written policy. They're no different in that. We all agreed on that. But the Leon Amendment does not specifically authorize the hospital to include the issue of medically or therapeutically contraindicated. which is a concern for the hospitals. And if you're not concerned about the hospital's concern, then that's not your concern either. I mean, other people wanted to balance things differently. The real nub here is whether you put that language in or not. In both cases, the hospital gets to draft their policy. But I think that if a hospital drafted a policy that was entirely on the basis that medically this is contraindicated and somebody could not visit, that hospital would be in jeopardy. And if you put it in the licensing statute, I think that hospital would be in jeopardy of losing their license. That may be far-fetched. It may be a stretch, but it's a concern I have.
You know, I think a lot of us need to go to the bathroom right now. And as soon as we're done doing that, I think the Democrats can have the room here and the Republicans can have the breakout room over there. And let's do our business and followed by our business and be back here in about 10 minutes. Thank you. Representative Leon wishes to go get another amendment crafted. My 30,000-foot down view of it is to pick up some of the language of Representative Weber. I do suggest you both chat, and we'll see if we can come up with something better tomorrow. Representative Knurk.
Yes, I was just going to say for efficiency, although I appreciate that we might want to wait and get a new amendment, was there any way possible we could just parse that language so that we actually submit one that we all like, and then we can just get on with it? If there's no reason for secrets, we try to work together.
Well,
and if we wait and we don't see it till tomorrow, and we don't like that, then that's a problem. We could try to come together right now.
Representative Weber?
And we can all address it here in an executive session. I don't feel comfortable at this point in the process starting over with just two people talking about it. I don't speak for everybody on my side, and I certainly don't speak for anybody out there. So if there is a compromise that you're considering, it would be very helpful to have it stated so that we can indicate immediately whether that's going to be helpful or not, and then move ahead.
Representative Leon?
Thank you, Mr. Chairman. This is looking to put back the presence of visitors being contraindicated with some guide rails about providing the reasoning in writing, just so that we can make sure that those policies are actually individualized and not just a quiet hospital policy. Need to get the actual language right, but that is the intent of that amendment.
Representative Merchant?
I'll default to
Representative Weber?
And would that be put into the Patient's Bill of Rights or into the licensing statute?
It would be in the licensing statute.
It's a non-starter for us, for me personally.
If I may, why in the facility versus the patient's bill of rights? We're talking about the patient here, not the facility. And I think we're trying to be sure the patient has their rights, and therefore the facility has to honor their rights. So therefore, indirectly, it becomes part of the facility, but it's actually in the right place because we're talking about patients, not the facility.
Representative Leon?
What's the consequence today for a hospital not following the Patient Bill of Rights?
Ms. Minahan? Ms. Rogers?
Yeah, there.
So, I need to actually review the statute. I'm not, an expert on exactly what the consequences are, but they can be challenged, that someone can raise it with the department. Again, it does fall under 151. It's just not a condition of licensure per se. But the Patient Bill of Rights are posted, and those are available. I think a lot of hospitals post them, in an actual poster, posted in their facilities, and they are also posted and given to a patient when they are admitted to the hospital. So those are their rights.
Would you have any objection to moving it up to Patient's Bill of Rights?
Yes, I would.
And what's the objection?
My objection is there's been a lot of broken trust, and I know a lot of people who will refuse to go to the hospital, and they would rather die at home than be denied the opportunity to have their loved ones with them. I know many, many, many people who now are opting out of the medical system because they have lost this trust. If the hospitals are doing the right thing on patient visitation, then their licensing won't be at risk. The option to have the written hospital policy for visitors provides a lot of leeway for the hospitals. And we need to start rebuilding this trust. And if the hospitals may have some threat against their licensing if they don't honor their own policies, well, I thought that's why we had policies. So I will not support it being solely in the Patient Bill of Rights because we need to make sure that those rights are actually enforced.
And I'm just going to say, that is a stunning statement for you to say that the hospitals need to rebuild their trust. They have been taking care of patients for hundreds of years, actually, and in the last 2 years have been under extraordinary stress. I on behalf of our hospitals and our caregivers, that is a very stunning and upsetting statement for me to hear you say that.
Miss-
I don't really think I have anything else to say. Representative. thank you.
I think that means we need to do more to rebuild. I have had hundreds of people share that. So once we get past these sessions, hopefully we can build back those relationships.
My suggestion is you go do what you need to do, and we'll do what we need to do. This could go on all day. I'm going to take 3 more people, and then we're going to move on. Representative Gay, you've been patient.
Thank you. I just wanted to ask why well, I shouldn't say it negatively. I would like to say keep the stunning requirement in the Leon Amendment and make sure it's in the Patient Bill of Rights too.
Representative Merchant.
One of the things too we're forgetting is about the licensing. There's also accrediting organizations out there. And having worked in hospitals for many, many, many years, even though it's not a legal requirement, but the accrediting organizations will not accredit a facility if they don't comply to the basics of what's required of them. And one of those is actually the Patient's Bill of Rights. So even though we don't pull their license, if the accrediting organization does not accredit them, at that point in time, they would lose the revenue stream. So there is a consequence to them for not following the Patient Bill of Rights versus just looking at it from licensing. So there is, in my opinion, I don't know, again, I'm not an attorney, but that's my understanding, is don't forget the accrediting organizations that are out there and the impact they have on facilities and how they follow certain things. Because if you lose your revenue stream from an organization, that's going to be really critical to you.
Last one, Representative Weber.
Thank you, Mr. Chairman. It's very clear that we have 2 different points of view here. It's very clear that we are still going to have 2 points of view tomorrow. We have 2 competing amendments in front of us. And I will just say, my family and I looked after my husband at home in his last illness because that's what he wanted. Patients make these decisions all the time. He didn't want to be in a hospital. He wanted to be in his own bed. And I thank God, even though I'm not sure I believe in one, that we were able to do that for him. But everybody has to make those decisions based on their own comfort level and their understanding of their needs. I think what we should do is just go ahead and vote the amendments that are in front of us one way or another and then go to lunch.
The chair is going to rule that Representative Leon may come back with an amendment tomorrow, and then we will vote the amendments, and I do not know at this point in which order, because the first one that is voted in will be replaced when the second one is voted in. So this ends, for now, the hearing on 1439. I now open the exec session on House Bill 1244 relative to parental consent to medical and dental treatments of children in schools. Representative Cushman's bill, and has an amendment.
Mr. Chair?
Yes?
I have one. It's also an amendment to this, which is upstairs on the printer.
Okay, go get it, please. 1244. You can start by reading the Cushman Amendment, which is 0499. You should have been given it.
I'm in your direction right now.
Oh, and here's another one, just because it's you, Ken. Yeah, because it's you, we're going to give you another one. You're welcome, try to do our best for our friends. Oh, I already have one. Because we have 23 bills eventually to do, and we've only done 3, when you get the amendments, please read them, because we will not stop for you to do it. Do it now, please. Representative Cushman, please introduce your amendment 0499.
Thank you, Mr. Chairman. So before us, we have an amendment to this bill that requires explicit written consent from a child's parent or legal guardian for any treatments in school. We expanded it to also screenings, since we heard testimony that there were some screenings performed that are invasive, and anything that is not related to education, anything that's not educational in nature that's going on in public schools should require a consent from the parents. And the other major change is that it also inserts the language into not only the Department of Health and Human Services statutes, but also the education statutes.
What line does the education statutes appear?
That is Section 3. Under school health services. So
Okay.
it's RSA 200.
Got it. Thank you. Representative Merchant, your amendment looks almost the same.
It is almost the same.
That's why it looks it.
After having some lengthy conversations with someone in my family who's been a school nurse for many years, she did point out that in regards to treatment, it's currently, their policy has been that way for a long time, that you cannot provide any treatment to a patient, or in this case a minor, without the explicit written consent of the parent. The screenings, on the other hand, become problematic because a lot of times it's the absentee parent that doesn't provide good parental oversight that needs to have the attention. And screenings are not treatment. It is basically, it's a screening. Picking up on a child's vision, hearing, etc., is critical to that child. And I just want to be sure that when we talk about something that's not invasive, it's strictly a screening, that we're trying to protect the child from the offsuit, if you will, of not having someone taking the time to sign a form. Because vision is critical, hearing is critical. You cannot learn accordingly if you don't have the two of them, along with other things. So she really advocated on my behalf, which convinced me to take the word screenings out of this, to allow that to occur without explicit written consent of the parent. A lot of times parents will probably provide it, but don't want to have it a requirement because, again, go back to the same thing she said, Gary, the children who need it the most are probably the children who are being neglected the most. So she said you want to protect those children because it's only a screening, it's not treatment.
Further comments from anyone? Representative Knurk.
Yeah, I was curious. Can you give an example of an invasive, in quotes, screening?
Well, yeah, dental screenings are very invasive. They enter a body cavity, and especially for kids who have sensory issues, this can be a problem. I would say that any screening, really, because this is an educational environment where students are meant to be educated. It is not a community health clinic. You know, it's nice to have that available, but at the end of the day, people send their kids to school to be educated, not to have medical interventions and screenings performed. So if that's going to happen, there needs to be positive consent for that.
Representative Knurk, follow-up.
Just a quick follow-up. I would agree that that would be wonderful in an ideal world, but our public health system does not exist very well here, which is why we actually also feed children at schools and other things, because we unfortunately dump onto our schools a lot of the things that should be done elsewhere. And it would be wonderful if everybody had good health care access so they would get that screening, but they don't. And so that's a stopgap to try to help backfill so kids don't get lost in the shuffle and not able to learn because they can't hear. and they can't see.
The chair's comment is, I recall in school, eye tests, hearing tests, looking into my mouth, turning my head and coughing, and others I can't think of right now. And we discovered that the ones where there was, something's wrong here, were the kids who least likely ever went to medical care. We were an educational and health center. It was called the Leominster Public School System. Representative Gay.
Thank you. My concern, I don't have a problem with doing the screenings at school. I do have a friend who has a child who has a sensory problem and doesn't want to be touched, and they have. But I'm thinking, don't parents have to sign a release at some point at the beginning of school, so there is a time and an opportunity for the parents who have reservations about certain things for their child. They do have that opportunity to say, I need to be consulted. But I think it's a good idea to do the screenings and just allow the exceptions to be covered by their parents.
Representative Woods, you had your hand up, I believe. I'm going to work down the row. Don't worry.
Thank you. I just want to emphasize that, in fact, what Representative Kirk mentioned, a medical intervention is providing lunch, and so technically we would have to get permission to provide lunch.
Representative Merchant.
I just wanted to respond to Representative Gay. Thank you for understanding what we're talking about. There's actually a relatively small set of parents that don't provide parental oversight. It depends upon the community, depends upon the economic status and so forth, et cetera. I cannot share with you folks some of the stories my wife brought home from school, but there are many parents out there who are very neglectful. And unfortunately, we have to have a backstop with those parents because those children are critical. And to Chairman Pearson's point of view, they don't always pay attention to the medical community. They don't even take the children to the physician. They don't even get wellness visits. What do we do with them? We have to somehow protect them from the neglect of a parent. And having that point in time, having a school nurse who's been trained to do the screenings. This is not somebody who's a teacher. This is a school nurse who's gone to school, most likely for 4 years, who's been accredited as a school nurse, who understands how to deal with a child. So we're not talking about just anyone in the school building doing the screenings. We're talking about people who are relatively trained to do it. So I'm advocating for those children who don't have parents the way we think of parents today and how to protect them. Thank you.
Representative Shapiro.
Yes, thank you. This is a question. I'm not sure if this is intentionally left out or purposely left out. But one issue that I'm thinking of is that currently children at the age of 14 are able to consent to sexually transmitted disease treatment and diagnosis. I think that's probably irrelevant because I don't know of any schools that have like a clinic within the school, although that's possible, but I don't know of any in New Hampshire that have that. But in regard to substance use, diagnosis, treatment, prevention, there are many, many schools that have people who provide those services in the school. And state law, and I think federally also, those people are allowed, those children, minors are allowed to consent at the age of 12. So this, the way this is written, it doesn't make any exception for those kind of services that happen in schools. And maybe that's intentional. Maybe you don't feel like those should be provided in schools. But that would have an enormous impact on the schools as they exist today and what they offer today. And also on the changing the access to substance use disorder services.
Representative Weber.
I just had a quick answer to the concern about the child with sensory issues, which is a very real concern. First of all, as Representative Merchant said, a trained professional is going to take those into account in performing a screening. And it may be that the screening can't be performed for good and sufficient reason because it would cause way more harm than it would. But the other remedy for that is that the parent who is concerned about their child writes a note, as my mother did at the beginning of every single school year, which said, Lucy is not to drink whole milk. So I didn't. I wasn't actually allergic to it, but I hated it so much that I could blow my cookies every single time. And I had any number of people who thought they were going to teach me to drink milk, and they were all wrong. But my mother wrote a note. And so if a parent is concerned about a particular approach to their child, which is inappropriate for their child, they write a note and say, don't do it.
Now, this side of the room, anybody? Representative Cushman.
Thank you, Mr. Chairman. So anything that is done to children in schools, I think that is not educational and isn't part of what parents expect to be happening to their kids needs to have consent. There is no reason that this can't be part of the beginning of the year packet that goes out and the parents sign all the forms. And if they see the form and they say, oh, my child shouldn't have this dental screening, we you know, for whatever reason, I don't want them to have it, they should have that right. We can't punish or take away rights from parents just because we are
I can't hear what's going on here, please.
because of a small percentage of people who would abuse that right. And if they are medically neglectful, then they should have child protective services involved, and the school can pay attention and make that decision to report if it comes to that. But at the beginning of the year, to have a form in the packet that goes out, it's not a huge ask, and it ensures that parental rights are honored.
Anyone else over here? Okay, Representative Snow.
Thank you, Mr. Chairman. A personal story, my wife, who grew up in a very middle-class family with very caring parents, and she, when she was in school in first and second grade, realized that she had to sit in the front row because she couldn't see anything on the blackboard unless she sat in the front row and went up and asked. And the parents had no real inkling that anything was wrong because the report was never done. She had a screening, and a school nurse one day came knocking on the front door of their house and said, you need to take your daughter to an eye doctor. She really has a deficient vision. The mother was very embarrassed. They immediately took it. She's worn glasses ever since. And thank the Lord they did the screening. I remember she tried out for the softball team, never did see a ball in the air. She said she just swung and hoped somehow she came within close proximity. But I think in many cases, and I think to have those forms put in the folder at the beginning of the year, those same parents that don't do it are not going to sign those forms either. So the people that need the screening the most, but there are people from families like my wife's family who benefited greatly from having that screening and done at the school. Thank you.
I have a story. His name is Eddie. And we all knew Eddie was deaf. His parents didn't. And one day, Eddie got the hearing test screening that we all did. And a note went home, you ought to go get your kids professionally ear hearing. We don't think he can hear. And the parents weren't bad. They weren't angry. They were just clueless until the note went home. And Eddie was fitted up with hearing aids, and he could finally hear the teacher and do better in school. That was a screening. The school didn't make him get hearing aids. The school sent home a note saying this is something we, in the learning process, you'd send your kids to school to learn. If they're not learning, why is that? There's a diagnostic thing for dyslexia. Is that invasive? No, Johnny can't read. Why is that? Screenings, not treatments. So another hand. Representative should wave off, okay. So let me ask our parliamentarian the protocol here. I was under the impression if an amendment is adopted and then the next amendment is adopted and both replace the same thing, the first one goes away. I want to do this right, and this is new to me.
What normally happens is each person decides which amendment that they approve. They're competing amendments. Each of us has one we prefer. If each of us decides which one we prefer and vote yes on not to pass on that and no on ITL on the ones they want to keep, it comes out right, because we should not be voting the same way for two amendments if the amendments are competing. What I've seen happening in the if it happens, I don't know what happens. I suppose the last in time controls, but my concern is I don't see why anybody would vote yes on two different competing amendments. What we have done at some points in the past is we've had an amendment that amends the first paragraph of a bill, and everybody agreed that that made the bill better, and then we've had a second amendment that changes paragraph 12 of a
Right.
bill, and everybody liked that. And OLS can just put those two together into a committee amendment at the end.
What
But
we have before us is two.
I would urge people to vote ought to pass an ITL rather than ought to pass on everything, because that's way lies
So if
confusion.
I understand, I could ask, and it doesn't matter which order. Representative Merchant will move OTP, and then we'll count the votes. And then Representative Cushman, or in the other order, would move OTP.
Yeah.
And
The amendment.
yeah, on the amendment.
Yeah.
Each amendment. And those who want Representative Cushman's would write, do yes. And we hope one would come out one way and one would come out the other.
Yes.
Okay, I got Representative Cushman's amendment in my midst beforehand. Let me get my cheat sheet here. This is House Bill 1244, Representative Cushman's Amendment 0499, and Representative Cushman for a motion.
Thank you, Mr. Chairman. I move that we adopt Amendment 0499H to House Bill 1244.
And the second is to Representative DeLamis. And would the clerk please call the roll on Amendment 0499 to House Bill 1244?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton. Yes. Representative Gay. Representative Cushman.
Yes.
Representative Folsom. Yes. Representative Kelsey. No. Representative King.
No.
Representative Kofalt.
Yes.
Representative DeLamis. Yes. Representative Weber. No. Representative McKay. Oh, I'm sorry. Okay, Representative Freitas. No. Representative Snow.
No.
Representative Knirk.
No.
Representative Query. No. Representative Cannon. No. Representative Nutter Upham.
No.
Representative Shapiro. Representative Woods.
No.
Representative Merchant. No. Representative Pearson.
No. 14 to 7.
Yep.
The amendment is defeated 14 to 7. The chair recognizes Representative Merchant for a motion.
Make a motion to introduce to House Bill 1244, Amendment 2022-0979H.
And is there a second? Representative Pearson seconds it. And when the chair is ready, please call the roll on the Merchant Amendment 0979 to House Bill 1244, moved by Representative Merchant, seconded by the chair.
Thank you for the promotion to chair. You just promoted me to chair.
Why did I do that? I
When you asked-
seconded it.
when you asked me to call the roll.
Okay, you want to swap seats?
No,
I used to do that job, you
I know you did.
Okay.
I know you did.
That was only to separate me from, you know. Okay.
Yeah, well, they need to separate us sometimes.
Who's the
okay.
common one in this, I ask? Okay.
Sorry. Okay, back to business. Okay, Representative Leon,
Yes.
Representative McMahon, Representative Acton, Representative Gay, Representative Cushman,
Yes.
Representative Folsom, yes. Representative Kelsey, Representative King,
Yes.
Representative Kofalt,
Yes.
Representative DeLamus, Representative Weber, Representative Freitas, Representative Snow, Representative Knirk,
Yes.
Representative Query,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Woods,
Yes.
Representative Merchant,
Yes.
Representative Pearson.
Yes.
Passes 21 to
21 to zip. Now, the chair will entertain somebody who would like to make a motion ought to pass as amended.
I'll make the motion.
Representative Merchant will make the motion, and I would like to see a second from this side over here. Representative Cushman, of course. The motion is ought to pass as amended by Amendment 0979. This is House Bill 1244, moved by Representative Merchant, seconded by Representative Cushman.
One moment. Representative Leon,
Yes.
Representative McMahon, Representative Acton, Representative Gay, Representative Cushman,
Yes.
Representative Folsom, yes. Representative Kelsey, Representative King,
Yes.
Representative Kofalt,
Yes.
Representative DeLamus, Representative Weber, Representative Freitas, Representative Snow, Representative Knirk,
Yes.
Representative Query,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
No.
Representative Woods,
Yes.
Representative Merchant, Representative Pearson.
Yes.
20 to 1 passes. Consent.
Any objection to consent? Representative Merchant, I will be very happy to receive your most excellent committee report. Thank you. And since it's going on consent, there will not need to be another report written. Thank you. Okay. I know of at least one member who needs to be out briefly at 1 o'clock, so my plan is to push through till about 12:30 or so, and then have a slightly late lunch break. Okay, let's try number 1633.
Slam dunk.
You are.
ITL. You gonna make the motion? ITL.
What was the last one you just did?
1244.
44. And the box score on 1244 was, in its original form, 579 supported and 156 were against. Now let's, since we're moving to 1633, the box score on this, 1633, 267 in favor of requiring COVID vaccination for school attendance, and writing in against 2,929. You asked. I didn't know that many people could write. Chair recognizes Representative Leon for a motion on 1633.
Thank you, Mr. Chairman, and I move an expedient to legislate on House Bill 1633.
I'll
And
second that.
second by
I'll second that.
Is it, that's you?
Merchant.
Oh, merchant. Oh, okay. Okay, we'll accept other side of the playground. Okay.
And would you like me to speak to the motion?
Sure.
Okay. I think if we recall the testimony, Department of Health and Human Services at this point has no intention to add the COVID-19 vaccination because there's no consensus. Therefore, this bill is at best premature, and I believe that we should vote it inexpedient to legislate.
I will second those comments.
Anybody else? Representative Shapiro.
Yes, I would also suggest that we ITL this bill. I think that we're best off when consensus drives lawmaking and not when lawmaking drives consensus. And as indicated by the sign-ins and as indicated by a lot of controversy about this, we don't have a consensus on this issue. So I think we should ITL the bill.
Anybody else?
Vote.
Great idea. Thank you. I was thinking of that. So, we are going to vote. Moved by Leon and recommended and seconded by Merchant, ITL, on House Bill 1633. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow. Representative Knirk.
Yes.
Representative Query. Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro. Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes, and who gets to ask me to ask the question that I always forget?
Consent?
Shall we
Consent.
put this on consent?
Would you like this to go on consent? Yes. And if she hasn't already done so, would the vice chair please write the blurb? We have blurbs for sale, by the way. We spent some time writing a whole bunch of them, some of which will never get used, but okay, good. 21 to zip. This ends the exec session on 1633. And I would like now to open the exec session on 1044. And this is kind of what astronomers call a binary star. As it eventually evolved, they rotate around each other. 1044 with an amendment that's coming and 1347 with an amendment that is coming are very, very similar. And so I will call on Representative Cushman, who is the mother of these two amendments, and speak to the one on 1044. And then right after that, 1347 ought to go quickly.
Thank you, Mr. Chairman. The amendment you have before you, you
no,
will
we
see.
don't.
The
Oh, I'm
amendment we
sorry.
don't have
That you
before
will have before you.
It is called
I'll wait.
907. We'll give everybody a few minutes to read it. Representative Leon, would you please introduce
Cushman will.
Representative Cushman, like it says right in front of me?
Thank you.
Would you? You're welcome.
So, Amendment 22-0907H.
One.
This, so we weren't sure on the, what kind of model, but we are sure that we need an alternative option for healthcare in New Hampshire. So it includes membership-based business models, the amendment does, and the direct pay only facilities. It also, we needed to incorporate something into the Patient Bill of Rights because as it stands, the Patient Bill of Rights for medical facilities licensed under 151:2, it has a few mentions of Medicare and Medicaid and not discharging based on source of payment. So those obviously wouldn't apply to these direct payment and membership-based business model facilities. So similar to the Home Health Agency Bill of Rights, they are exempt from the current Patient Bill of Rights for medical facilities and have their own Bill of Rights, which is exactly the same, except it removes those 5 lines that have to do with Medicare, Medicaid, and insurance.
Representative Weber.
Thank you. And having looked at it, I understand the need for the difference there, but I am, first of all, very concerned that this bill, which was only originally about payment for a facility that operates on a membership basis, suddenly we are incorporating the Patient's Bill of Rights, and that was something that was done with no notice to the public or operators of a facility that might want to operate under these things, and I'm not at all sure that it's a germane amendment to begin with. It troubles me that there has been no opportunity for public comment on it in any case. But I think that the concerns that a number of people expressed on a membership basis business model continue to be, I mean, I think the drafting may be a little better than the original drafting, but I think that the concerns of the people who opposed the original bill are still going to hold good for this. These are the sorts of facilities that siphon off patients who can pay from facilities that are operating on the edge, and I think that given that we can't change the whole thing right now, I think it's fine that somebody wants to operate on a membership-based business model, but I think they ought to be subject to the same rules as everybody else. So I'm opposed to the amendment and opposed to the underlying bill.
Representative Merchant.
Thank you. The other concern I have in here, there's no requirement for them to submit data to the New Hampshire Department of Health, so Department of Insurance, to provide transparency. All the other facilities are going to be required to do that. Number two, when you look at things today, a patient can actually go on site and find the cash payment by any facility for any service they provide, including, by the way, dental services. It was an interesting site to go to. It's very robust, has a tremendous amount of data there. So a patient today can actually be proactive, look at what the procedure is, if they have a high deductible, and decide where they want to get it done. So therefore, I think we already have free market competition in this market today. I support the free market. I think it's the way we always try to bring transparency and pricing down. But I believe today we have a system in place that is, in fact, very transparent, that the patients can utilize and to their advantage. And therefore, once we educate them on how to do that, we actually, in fact, open up competition in the marketplace because we educate patients on where to get the information.
Representative Cushman.
Thank you, Mr. Chairman. Representative Merchant, first, you are incorrect that they do not have to submit information to the department. This bill only alters section, paragraph 1 of 151:2 dash F. And the relevant pieces that you're talking about are in a different section of the law. They are in, just gotta find them. I'm in the wrong section, I'm sorry. Here it is. Section 2, they must adopt, publicize, and apply assistance plans. So they still have to have assistance plans. This is Rep. Mark McLean's bill, and it never altered that requirement. They also need to, in paragraph 3 of that section of the RSAs, they need to provide data to the Commissioner of the Department of Health and Human Services regarding the volume, cost, and outcomes of services provided in the facilities. And they need to pay the fees for licensing. So they still do have to do everything that other facilities have to do, except take all forms of payment. And we've seen that the requirement to accept all forms of payment has become very onerous and controversial because CMS is included in that. And we have seen mandates and regulations that many businesses do not agree with, many consumers do not agree with. And currently in New Hampshire, there are no alternative options. And we need to allow for those options to spring up, let the market work, because right now it is a closed market that is only open to those who accept CMS.
Representative Knirk.
Couple things. I would like to echo what Representative Weber said before. Basically, again, particularly if we look at our critical access hospitals, they function on razor-thin margins. Yes, indeed, there is cost shifting. That's how they stay afloat. Representative Cushman made a very good set of arguments when she presented about how broken our healthcare system is, a good argument for why we need to reform it, perhaps need a single-payer system. But this is not the way to do it, because it simply will not work. We can look back to a time when we did have a little bit more free market, and older people couldn't get health care, because who's going to insure somebody who is old and poor? They're not a good risk, or just poor, because it's not going to work. And that is why we had Medicare and Medicaid get formulated, because it made more sense than letting these people simply die in the streets, which is what was happening. Now, this is going to siphon off the paying patients, particularly from our critical access hospitals. And we have seen closure of maternity wards, because that's a loss leader for them, and they cannot afford to continue to do it. The rate of births by police increased in Laconia when they closed their birthing center. These are real impacts. I live in a place where there's not a lot of choices for medical care, and if you put a birthing center there, it's going to close Memorial Hospital, or it's going to siphon off any of the ones that do pay, and they're going to have to just drop it. But I'm also very troubled by the fact that I think this does have a great deal that's not germane. It adds an enormous amount to this bill, including a whole separate patient bill of rights for the direct pay and membership based. And actually, interestingly enough, because of the fact you're describing that, so to remove them, we have the patient. It's actually the point I'm getting at is there's a lot here to try to look at. It's not a simple amendment. On Section 5 of the original Bill of Rights, it says that if you suddenly go on Medicaid because perhaps you've spent down your assets, which happens to many people, they can just throw you out in the street unless you are required to take Medicaid payment, which is, of course, the major source of our payment. And I'm trying to see, in your number 5, in the new Bill of Rights, or for non-payment for the patient's stay. So it says that the patient can be discharged for non-payment of stay. So, and they don't accept Medicare or Medicaid. So that means if a person now has spent down their assets, they're in a nursing home, we're going to throw them on the street. So I would say that this bill goes beyond, first of all, siphoning off health care from our critical access hospitals, leaving them to get into financial trouble to being just downright wrong.
We've just received an opinion from the clerk of the House that this amendment may not be germane.
That's what I'd say.
I'm not sure if we need any further discussion on it.
Well, it's the speaker's purview, so maybe we should ask him.
Okay. That will be my job. So if you could excuse me for a few minutes. So I don't tie you all up, I'm going to postpone, move, close, recess the hearing on this. So over your lunch hour, I can speak with the speaker. This will be on 10:44 and probably therefore 13:47. And just while I remember the information, Representative Shapiro likes to know this. 2 bits of information. Sign in on the original Bill 1044. The number was 417 for and 3 against. But a year ago, when pretty similar to this came to here, it was 18 to 3 ITL. So there's your numbers. So I will deal with that over the lunch hour. And top of my stack here is open the hearing to executive session to 1481, repealing the statute relative to medical freedoms in immunizations, the Representative Horrigan's bill. And while I've got my sheet here, 1481. And 119 signed in favor of his bill, and 362 signed in against. 1481, and somebody has already signed to do this. So the chair calls on Representative Erica Leon for a motion.
Thank you, Mr. Chairman. I move an expedient to legislate on House Bill 1481.
And do I have a second?
Yes, I second.
Thank you. Discussion.
Thank you, Mr. Chairman. This bill seeks to repeal the protections that are in statute about people's choices around vaccination. Without informed consent, treatments are unethical. What we need to do to increase vaccination rates is to convince people of the science, the data, and the protection, not to coerce them by limiting their access to public accommodations, to schools, or to any other services. That is not the way to build public health, to respect people's rights, and to get people's enthusiastic cooperation. The way we do that is by having data, following that data, and not mandating things. When we had the committee to study medical interventions and immunizations, we heard from many, many people. We also realized at that time that as soon as the mandate started coming down, the vaccination rate started tailing off. Once people were being forced to be vaccinated, they were wondering what they were missing. If you have to force me to do this, is this really in my best interest? And that actually caused, I believe, caused a decline in the acceptance rate of the vaccinations. I'm thankful that we have this statute in place. I think that it is critical because discrimination for a medical choice is wrong. No matter what medical choice that is, it is wrong. And therefore, I believe that we need to keep the statute as it stands and ITL this bill.
Representative Shapiro.
Thank you. I will be voting or to pass for this bill. And small picture, I think it's a problem that the statute as it currently exists does not include an exception for public universities and public colleges, which have congregate living the same way that nursing homes and state-run hospitals like Glencliff and New Hampshire Hospital have. They both have that in common. Dorm living, congregate living, hospital living, and yet one was accepted from this act and the other was not. So that's a small picture of something in the statute that I disagree with. But larger picture, you know, I think there have just been not one bill, not two bills, and not scores of bills, really, which are promoting ideas about privacy, personal liberty, choice. I understand these bills, but I think the bills that have been coming to us day after day after day are so heavily weighted in terms of personal issues. And where is the concern about the common good? Where is the concern about public health? I think that we have just tipped the scales in terms of privacy, personal liberty, choice, and we are not taking into consideration the greater good for the greater number of people. I mean, I think a lot of the things that we decide here have dueling goods. And I think that we are way over on the side of, we talked earlier, or somebody talked, Representative Leone talked about trust. And I think these bills, one after another, in my mind, are what's building this distrust. So I don't think we need this bill. I mean, I don't think we need the statute. And so I'm going to vote ought to pass.
Representative Acton.
Thank you, Mr. Chair. A lot of these bills are pushback in response to what we've been through. So they didn't just materialize out of thin air. A lot of it's based on what we've endured through COVID. And it's been intense. It's been a lot of loss of liberties, one thing after another. And we've hit a brick wall here as far as the department and the associations and the lobbyist groups and so forth in opposing what the majority at least is trying to do. So yes, we have a lot of bills, and we all notice that. Some of them tend to be a little bit knee-jerk in reaction. We're working through that, but these were not just brought out of thin air. They happened because they were a response to what we feel is overplaying of your hand by the medical system. That's it.
Representative Merchant.
I'm going to take a different tack on this. If we repeal this statute, then we're also at the same time repealing the ability for a nursing home to require a vaccine. So in essence, it's not just a question of looking at repealing it from the patient's right per se, but it's also appealing the fact that we carved out of here exceptions to this. And if we repeal that, all those exceptions go by the wayside. And I'm concerned about those exceptions not being there for all the reasons why they were there in the first place. So I'm taking a different tack on this and saying I'm against repealing it because I want to protect those that were excluded so that they are being able to be protected in some of those vulnerable places we have.
Representative Knurk.
Those exceptions were put in because of this act. Those exceptions, if this act goes away, those exceptions are still there. The nursing homes prior to this act were allowed to mandate vaccinations, which they do for any number of other diseases. The only reason, because when 220 came initially, which is what this bill was last year, it did not have these exceptions, and we realized that this was going to cause any number of issues, such as, for example, you couldn't involuntarily commit somebody for mental health treatment when they're suicidal. So that was carved out as an exception. The exceptions are there because of this bill, if this bill goes away, the exceptions aren't needed because they were already in practice. So that's not a problem. Yeah, that's enough said. Oh,
Yes,
sorry.
follow up.
Yeah, just, and plus also we saw in 1604, rolling that back anyway, losing that exception. So it's perfectly reasonable just to get rid of it. We aren't going to be in trouble with it.
Seeing no further questions, ask the clerk to call the roll. On House Bill 1481. Sorry. Yes, sorry. On yes, the motion is ITL on House Bill 1481.
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow. Representative Knirk.
No.
Representative Query. Representative Gannon. Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
12 to 9, it passes.
I'll take it back. The bill, the motion ITL succeeds 12 to 9. Therefore, the bill is killed. And would the vice chair please write the committee blurb? And who wishes to write the minority report? Representative Shapiro, thank you so much. We'll try one more, and if it takes longer than long, we'll just stop. That ends the executive's session on House Bill 1481, and I open the executive session on House Bill 1455. The prime sponsor is Representative Packard, and it is relative to state enforcement of federal vaccination mandates. And while I think about it, there were 513 people signing in favor of it and 98 against. We had thought there might be some amendments, but eventually the conclusion, which the speaker agreed with, is just a straight up bill. This is the bill. And as the chairman of a speaker's bill, I recognize myself for a motion, and I move ought to pass. And that is being seconded by Representative Cushman. Now let's discuss. Representative Knirk.
Well,
I'm sorry? Oh, I know I would, but I'm doing three things here. On both.
Just the other one. Which one is the other one?
It just says the speaker wants me to go over there. So, who would like to speak for it? Representative Cushman, you seconded it.
So we have here Representative Packard's bill. We decided no amendments are needed, and we want to say to the federal government that New Hampshire is going to do things the way New Hampshire is going to do things, and we are not going to be blackmailed by the federal government, and we will not enforce the federal government's dictates that we need to mandate vaccinations or comply with that. So we're not going to send any information to them. And other states have sanctuary policies for immigrants and when it comes to enforcement of immigration laws. And if those can apply there, then this one can apply here.
That's what I was going to say. Representative Knirk.
Yes, thank you very much. Once again, we're back to the same arguments that were made in 1604. We do have, this will interfere with the ability of our hospitals, for example, and including our nursing homes at the county level, which are political subdivisions, to be able to set their own policies or to actually, in this particular case, to follow the policies of the CMS mandates, which will put their funding at risk. And I know that the argument keeps being made that it hasn't happened yet in other states, but to remember that it is a new requirement, and the first steps are to first determine that the person at the hospital, is out of compliance. After that are warning letters, the ability to remediate that lack of compliance, and on down the line before payment is withheld. And again, the Supreme Court, though it was a stay of an injunction, there have been no appeals filed yet against that injunction, and their language is perfectly clear. And in the CMS rules, it states clearly that if states pass other rules, that they are, that the CMS mandate rides over that due to the supremacy clause. That's in the rules, and they've also given that, what's the word I want to say, guidance. So with all that in mind, this gives us the same problem we had with 1604. It puts us at risk, and particularly for the nursing homes and for the hospitals, of funding. And that's not a matter of blackmail. It is a matter of following proper medical care. Proper medical care is to not unduly cause a patient to have an undue exposure to a communicable disease that they don't need to face. They have enough risks when they come in the hospital from the things that people like Gary Woods and I do to them. They don't have to face things that they don't have to face. And there are a lot of various guidelines that are set by CMS and by accrediting agencies for what needs to be done to make sure that proper standards are followed, whether it's central line insertion, whether it's infection rates, vaccinations, any number of things. And it is a matter of complying with that, not for blackmail, but for the best medical care. So I would vote against this ought to pass.
Any further discussion? The motion before us is House Bill 1455, ought to pass, moved by the chair, seconded by Representative Cushman. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. No. Representative Freitas. No. Representative Snow. No. Representative Knirk.
No.
Representative Query.
No.
Representative Cannon.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
No.
Representative Pearson.
Yes.
11 to 10.
11 to 10. The bill passes. Representative Knirk will do the minority report.
And I'm assuming ITL.
Yeah,
Yeah, minority opinion
Yeah,
is
ITL.
ITL.
Thank you.
and we'll find some
What bill was that?
guy off the street to write the committee report. Okay, this closes House Bill 1455. Before we break for lunch, the Speaker has ruled non-germane the amendment to 1044. We are asking him for a further ruling on the Amendment 937 for House Bill 1347 because they're very similar. So with that, come on back by about, we will resume at 20 past 1. Now I gotta go next door.
Yes, Susan. Sure.
This is completely Oh, I think he's just trying to get us. None of us want to be here Wednesday. We want to just clap. Oh, no.
Of all the extreme bills, that was just, I mean, but you know, what can you say?
I did, however, sub is,
Yeah.
Ollie in free. We're not on anything until I announce it. I think we're doing really well. Out of 23 bills, we've got 6 of them done, huh? That means we might even get, well, no, we're going to be there on Thursday. Okay. Well, we hope so, allowing time for blurbs to be written. Please, I almost said turn in your hymnals. Please.
Keep those in the holsters.
Yes. I don't think so.
Which hymnal did you want us to use?
The Lutheran one, Representative Konarek.
Okay. Well, yeah, but I don't
Yes.
have it here with me though.
We'll discuss that. Please turn to House Bill 1606, making the state vaccine registry an opt-in program. And we have an amendment chiefly authored by, with help, Representative Merchant. It will be 850, and it's coming around. 8? I'm sorry? I didn't hear you.
Yes.
And you have 0919 that's coming around. Oh, joy. Do we have that one?
Mr. Chair,
Representative Merchant.
there was also an amendment that Representative Lang created. Is that up for discussion, or we're just going to work on this one? It's not being introduced, right?
It is not. He's waved it off.
It's official. Because there's 2 that you passed out before, so I want to know if we're basically going to not consider them or want to move
He
to the
is
one.
withdrawn them.
He withdraw them. Thank you, sir.
Did I slam the gavel and say I was beginning the hearing on? I think I did. Yeah, I think so. Well, pretend it did.
Everybody have an 850?
Yes. And here's, the next one's coming.
Okay, yeah, I've got that anyway. I printed it out.
Yep.
919 is the one.
The only amendments you need are 850 and 919. Representative Lang's 2 amendments are withdrawn.
And Mr. Chairman, if I may, with permission from
Go ahead, Representative Merchant.
Thank you, Mr. Chair. If, with permission of Representative Cushman, Kelsey, and Woods, I'd like to withdraw 0850H and only discuss Amendment 0919.
Do the co-sponsors agree?
Yes.
I see. Yes. Okay, it's withdrawn. We're down to 1 amendment.
Right here. And the question was, what was the difference between the 2? The critical piece was a phrase at the end on line 13, which basically says at a point in time to participate in a registry. And also our illustrious Representative Cushman, who's our English major here, determined that there was a comma after form that needed to be inserted. So I want to say thank you. And by the way, even though my name came first, it was not by myself. It was a collective effort by all 4 of us. And I want to say thank you to all the other people who worked with us on it to circle the square.
I love it when a plan comes together. Would somebody care to speak to 1606 Amendment 919? What does it do?
I'll let Representative Cushman, if she wishes to do it.
Sure. So this amendment takes the intent of the bill, and there were some questions whether we should, write out a form that can be passed out, and it was decided among us that it would be best to not have a form in statute for this, and rather in section 2A, it clarifies that it is that each patient or parent or guardian, if the patient is a minor, are given the opportunity to opt out or opt in, and that only vaccines that are administered shall be entered into the registry, and that patients shall be able to receive a printout of their vaccination records if they request it from the provider. And then section B just clarifies and strengthens that opt-in or opt-out option to require positive consent for the information to go in.
Any questions or comments?
No. I think one of the things which was important, this came actually from an interesting gentleman in my life, lady in my life, who was also a school nurse, and he said, "What's in it for the patient?" And she said at that point in time, it'd be nice if you actually could allow the patient or the parent to go down to a provider and get a printout of the vaccine registry, the history, if you will. So if they want to go to a summer camp, if they want to go to a transfer to another school and so forth, they don't have to maintain the vaccine registry themselves. They can actually go down to a provider and ask for that printout. So she's basically said, focus sometimes on what's in it for the patient, not always what's in it for the provider. Wow. Strong patient advocate.
Representative Knirk.
I think this is really minor and we don't want to change it, but it's an interesting wording on lines 8, 9, and 10, that they may receive a printout of all vaccines in the registry. I think what you really mean is all of their vaccinations in the registry. Otherwise, this would be that they could get a printout of the list of vaccines that are in the registry or everybody's records, which we don't want. And I don't think that's what you mean. I know that's not what you mean. I'm just trying to figure out whether we really have to worry about the wording, or is this clear enough and implicit in what we're doing? The lawyer says it's okay, fine.
And the Senate maybe will fix it. Representative Shapiro.
Yes, thank you, Mr. Chairman. In my thinking, this amendment, this bill, really changes the vaccine registry from an opt-out to an opt-in program. And we heard testimony from various people, including Department of Health and Human Services, I believe, I don't want to speak for them, that this would be onerous for providers' offices, and also that it would decrease the number of people who actually participated in the vaccine registry, which would make it a less robust and less useful program. Of course, nobody can predict how much it will decrease the participation. It may be 3% or it may be 20%. Nobody can predict that. We will see, I guess. But I'm going to vote against this because of those two issues.
Representative Woods.
Thank you. We considered all of those and came to the conclusion that with the opt-in, opt-out, that would perhaps, if we kept it strictly as an opt-in, there perhaps would be as much as 3% loss as an estimate, and other people may have a more rigorous number. That balanced against the issue that if it was a opt-in, opt-out, people could still get the vaccine, okay, but not be in the not have their data into the registry. That would increase the number. As the bill reads, even though you opt out in terms of having your name and serial number in the registry, the provider, whoever provides the vaccination, can still provide an unidentifiable number. In other words, providing 10 vaccines on a given day, and here's 7 or 8 of the names and serial numbers, and I have 3 that are just vaccinations. So that preserves the public health aspect as much as possible. It seems that this was a nice balance between the people who wanted to not have their name in the registry, but still participate and get a vaccine. And that's really what we're after. The risk was that if in fact it was a total mandatory opt-in, there would be a finite number, unknown, that would say, I think I'll just skip the vaccine entirely because I don't want my name in the registry. And therefore, you miss that number. So balancing all those factors, it seemed like the smartest thing to do that would give the greatest balance between what everybody wanted in their privacy, but at the same time preserving the ability to make good public health decisions.
Representative Kelsey.
Thank you, Mr. Chairman. I would also like to add, I feel like we incentivized the registry by adding the portion where patients can now obtain their records. Having a child in school, having a child that has gone to summer camp, that is extremely convenient for the patients. So I would like to add that I think that that incentivized the registry.
Representative Gay.
Thank you. I just have a question. I'm thrilled with this amendment. Do we have to specify that we report the count? That's great to have it. Do we have to say that in the bill?
You know, it's not in the bill. What happens is when a provider uses a state vaccine or vaccine from the state program, in order for them to replace that vaccine through the state program, they have to notify the state how many vaccines they gave, not who they gave it to, but I gave 10, and therefore those 10 go to the state program in order for them to replace the 10. Maybe there's only 9 in there that have a name in the registry, but they have to tell the state how many they gave so they can get replacement of it.
Seeing no further discussion, the motion before us is. Seeing one person before us, the chair
Just really a
recognizes
question on this.
Representative Knurk.
Does, given it says for each administered vaccine, that would mean then that the provider would need to do this if they're getting 3 vaccines in one visit? Or because it doesn't, it says for the vaccine, not for an event of being in the office to get a vaccination, or even if it's a series. And likewise, is it that every time that they're going to have a vaccine, they have to go through this, even though they've already done it before? Just thinking of the work burden for the office. Can you clarify how that works?
I can. The form, when it's created, it can list multiple vaccines at one time, so you're not filling out multiple forms. Number 2, in the workload in the queue, and I did talk to some providers about this, in the electronic medical record, the way they go through the process is a checklist that they go through. So you can, at that point in time, in the software, create a checkbox, yes or no, as far as the information going to the registry. So therefore, from the provider's point of view, it should not be an additional burden to them because it's just going down through a checklist.
Seeing no hands and hearing of no hands, now we are going to vote on the. We're going to have a motion to vote. And the chair recognizes Representative Cushman to make a motion.
Would Representative Merchant like to?
Well,
Oh, okay. All right. Mr. Chairman, I move that we adopt Amendment 2022-0919H to House Bill 1606.
And who named Representative Merchant would like to second it?
I will second that.
I thought he would. Thank you. That's what my script says. We have to do it. Are we ready? By silence. On Amendment 919 to House Bill 1606, moved by Representative Cushman, seconded by Representative Merchant. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Yes. Representative Weber. Yes. Representative Freitas. Yes. Representative Snow. Yes. Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
No.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
20 to 1 on the amendment.
20 to 1, and there's a very good reason why this won't go on consent. You know what it is? It's only the amendment. And now the bill before us. And I have Representative Kelsey. What is your motion?
Thank you, Mr. Chairman. I ask that we move ought to pass on House Bill 1606.
And who over here would like to second it? Representative Woods. This is the bill as
OTPA.
amended.
Sorry, ought to pass as amended on House Bill 1606.
Like my wife says, I try to listen to what you mean. Yeah.
We interpret it and write it down correctly.
Oh, yeah. Any further discussion? We're good.
Woods.
Representative Woods. The bill before us with the motion of ought to pass as amended is House Bill 1606, amended by 2022-0919, moved by Representative Kelsey, seconded by Representative Woods. Would the chair please call the roll?
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Yes. Representative Snow. Yes. Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
No.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
Passes 20 to 1.
Now, there's something you remind me at this point. Remember what it is?
Set?
Any objection to consent? So it is on consent, and Representative Kelsey, because you made the motion, you are awarded the blurb writing prize.
I think Representative Merchant wanted to write that blurb.
Did he now?
The one that makes the motion gets to write the blurb, sorry.
Not necessarily.
I'll let the ladies go first.
What are we up to now? 7 bills we've done? Wow. 8! Oh my gosh. That ends the exec session on House Bill 1606, and I open the exec session on House Bill 1139. And even though I've been practicing it all week, I'll get the word wrong. Ophthalmic. Yeah, ophthalmic. Wow, ophthalmic. Wow. That's 1139, and we have before us, I have before me, and you will have before you, the amendment, 963. Authored by Representative Merchant. And just for the record, pupillary distance has nothing to do with how close students sit together. An eye roll would have been sufficient. My granddaughter is really good at that. What is this? Oh, this is two. Oh, we do have another one. All right. You're going to get another one.
Yep, you're about
You're,
Here comes the others are coming.
some of these are not being presented. Let the chair announce what we're going to be looking at. And that is 0867, which you are in the process of getting from Representative Leon, and Representative 0963 that you have already gotten from Representative Merchant. Seems so. Speak to it. And yeah, get a sense, and if it doesn't sound like it's going to fly, there's no point in fixing it. Nice. I would happily recognize you. If I was out in public, I'd recognize you. I'd say, hey, there's my friend over here. I'm just trying to stretch out my two finger. Oh, that's fine. All right, where was my little cheaty sheet? Let's get stuck in something. All right, the chair recognizes Representative Leon about an issue in the incorrect drafting of the amendment. And that will help her get a sense of where she would like to go forward.
Thank you, Mr. Chairman. After hearing all that we heard, I had read through the Rung amendment and the Villou amendments that they had proposed, and I liked everything except for making an ophthalmist bring in a second professional in order to get the intrapupillary distance. My intention in drafting this was to take both of their amendments and simply strip out that intrapupillary distance. If there is sufficient interest to move this forward without the interpupillary distance but clarifying the prescriptions, I can get this redrafted correctly. But if we're looking more towards this merchant amendment and making sure that we are in fact going to require interpupillary distance, then I don't need to redraft this. Right now, this deletes section 2 and 3 of the original bill because it was drafted as a replace all. And I apologize for missing that.
So let's discuss what Representative Leon has posed to us, whether she needs to go forward or we don't think so. Chair recognizes Representative Knirk.
So I'm a little bit confused. What you're saying is the amendment as you drafted it is not what you intended because you did intend to still keep in section 3 of the original bill or not? I'm really confused as to what you intended and what you're thinking you might want to do. Can you clarify that for me, please?
Yes, and I apologize. I actually
right.
have a terrible migraine today, so
Oh.
it's always great to swim through mud.
Well, we passed that bill. We
Actually-
ITL'd that bill.
Having migraines?
If you can outlaw migraines, that'd make
be
me happy.
great.
Actually, you are correct because there would be no changes in 2 and 3, right? So because we strike interpupillary distance, it doesn't need to be amended? Okay, I'm new to this. I'd rather call out my possible mistakes than miss them, so
Well,
thank
just
you.
to clarify, so in other words, your intention was to not, your intention is to not mandate interpupillary distance measurement. Is that correct?
Yes, that is my intention.
I'm with you.
Call it housekeeping and declare victory. So your pleasure is to do what?
My pleasure is we go ahead and discuss it since I don't have a drafting error, in fact.
Okay, we can discuss. Representative Leon, let us know what your amendment is about.
Thank you, Mr. Chairman. My amendment is to keep the areas that were brought up about making sure that private label and brand name lenses can be substituted for each other, as long as they're the same manufacturer, that substitutions are just for health reasons, and basically to give a little bit more power for consumers to shop around without requiring one professional to bring a second professional in to write a prescription. That really was my challenge, because if it was something that was done in the regular course of business for the optometrist, ophthalmologist, if the professional writing the prescription, if it was part of their standard practice, yes, please put that on. But if they have to bring another professional in, I don't think that that's fair.
Right.
Representative Knirk.
And I very much appreciate that and agree, because the bottom line is there's really two steps. What the ophthalmologist or optometrist, because they're both doing very much the same type of thing, they're doing the refraction. They're saying, and that's why they call it a prescription for a spectacle lens. It's a prescription for the lens, and that tells you what the refractive power is, if you have an astigmatism, what the cylindrical correction is, the axis of that cylindrical, a prism if you're going to be having it because you have eyes that don't line up, all that kind of stuff. That's for the lens. And that doesn't matter whether you have one eye, two eyes, whether they're this far apart or above each other. That's a prescription to correct each eye. So that's why there's a prescription for OD and for OL. L? Yeah. Anyway, so the thing is, that's the prescription. Then, OS, sinistra. Yeah, so I forgot to go to the Latin, dextra and sinistra. So anyway, that's the prescription for the lens. The next phase is fitting, and that's a totally separate phenomena. Fitting is saying you've got your spectacles could be big, they could be little like these. Then you want to make sure they fit well for where the eyeballs are placed on the head and where the patient wishes to place them. If I place these up here or if I place them down here. That's a fitting issue. And basically, for me as an orthopedist, the same thing. I might say, I have a brace, this is what I need to have it do medically. Then they go off to the brace maker, and the brace maker is the one that takes the measurements of the limb, or the spine, in my case, the torso, and is then going to make that thing fit. And if it doesn't fit right, it's their responsibility to make it right. That's the person who's fitting. And if we interpose, if I, as the orthopedist, gave these measurements and they're not correct, then I'm going to lead him astray. So I think it's perfectly reasonable to leave it this way. I mean, there may be a person who goes in and says, hey, I really want to order it online. Would you just hold the ruler up and measure it. That's fine. They can do that if they want to, but they're not forced to do it. It doesn't become part of a spectacle lens prescription. And the bottom line is there are some things that just don't really work well online. If you order clothes online, they may not fit as well as if you've gone to a tailor. If you're going to order a hearing aid online,
No way.
it may not fit really well into your ear, because I have only a 2 mm canal on this side and a bigger one on this side, and that was a real problem with fitting. If I try to order it online, it's not going to work as well. So this it still allows that other stuff to happen because there are ways to measure it. But I think this amendment is perfectly fine. I think the contact lens piece doesn't need to be there because the FTC's there, but it does reinforce it in our statute, and that's fine. So I'm very comfortable with this.
Anything else about Representative Leon's amendment 867? Now let's look at Representative Merchant's amendment 963.
This, for myself, was kind of a tough one because of conflicting points of view. Ideally, the patient should have the best set of spectacles they can possibly have. Unfortunately, there's a lot of folks that are on fixed incomes that cannot afford a Cadillac but could like a Chevy. And the thing about a pupillary distance being provided, it may not be accurate, but for the vast majority of patients, talking to opticians, it's probably okay. For those who need to have progressive lenses or thick lenses, precision becomes important. So in listening to the testimony by the optician, and as a dispenser, I can understand where he's coming from. Once you write something on a prescription, as a dispenser, you're bound to what is on that script. So therefore, if we don't allow the dispenser the authority to change and modify the PD, we're locking them in and delaying patient care or getting the spectacles to the patient in a reasonable period of time. So this allows the provider to provide the PD if the patient requests it, and allows the dispenser to modify it to make it precise versus accurate. So I think it was a good compromise all the way around to allow for the patients to still have access to the PD if they desire to do that. If they're shopping around and so forth, they're aware of it, they can ask for it at the time in which it's written. And it also allows for the dispenser to modify it if they need to.
Representative Woods.
Thank you. I look at this from two perspectives and appreciate the perspective that Representative Merchant brought, which is the commercial track and thinking of this particular problem in getting the Chevy, shall we speak, instead of the Cadillac, to the consumer. And I appreciate that. I've been on the other end of the stick myself with my crazy eyes and trifocals. I pay a pretty penny. Nevertheless, looking at it from the medical perspective, what's going to happen in practice is the patient comes into the office and it has to have a PD on it, and well, you may need to have this changed, and it can be changed and so forth. What's going to happen is going to go to not every ophthalmologist, not every optometrist or optician, and not every online facility, but they're going to take that as gospel truth. They're going, well, we got one here, why should I measure it again? We got 17 people in the waiting room, got to take care of them. So here's a pupillary distance, you take it, and on next customer. So to put it on the prescription, even though there is the possibility, okay, of it, once it's on and society takes the physician's prescription as gospel, for the most part, okay? And I think that's where the imprimatur of having that being the primary basis to proceed, although some people will do fine, we also know that there are prescriptions that you can take a generic which don't work as well, okay? And we say not generic for that reason. And pharmacists are very familiar with what's called a narrow therapeutic range medication, typically thyroxine, if you have a thyroid disease. It has to be brand because a generic for a significant number doesn't work. So yes, you can get the generic the Chevy form, but it's not going to do the job. And I don't want to put the medical community in the position of pretending that this is really the best care that I can provide for you when it's really not.
Representative Weber had her hand up first.
I'm not going to weigh in on either of those issues, but I am going to say that this, express a concern that this makes significant changes in the contact lens portion as well as the spectacle portion of the statute. And I don't remember, maybe somebody can enlighten me, that we had any testimony at all about contact lenses or the opportunity for anybody to know that they might want to weigh in about changes having to do with contact lenses. And once again, I'm a little concerned about lack of germaneness. I will say the other thing that I'm concerned, that I will just note, is if this is the directive we go in, on line 16 of the Lay-On Amendment, there is a comma after the word cylinder and before the word axis that I think shouldn't be there. Or should it?
Representative Konerk, you want to clarify the
Yes,
comma?
actually, because I was working with optometrists, and I questioned that when that came in that original amendment. And it actually is sloppy wording, period. All of it is. When you have a astigmatism, you have not a spherical error, but a cylindrical error. And so you actually have to have a cylindrical refraction, but then you have to know the axis of that cylinder. In other words, does it go straight up and down or does it go across? And it really probably should be saying the cylinder refraction and the cylinder axis, but this is what the language that was in there was, the optometrist said jargon, and what they would accept is just to say the cylinder, comma, that means the refractive power, axis, that means the axis of it. They were comfortable that this would not be confusing. We could have made it all kinds of better, talking about, for example, if you have a prism, the prism base, orientation, strength, all that stuff, but you don't need to put that in there. They said it was okay, because what this is saying is what you cannot change. So it is, that it
So
does
the
add
comma
that.
is needed.
It
Okay,
makes it better.
my apologies.
That's okay. I didn't know either until I asked them, so it's okay.
The clerk pointed out to me that contact lenses is in the original bill, so mention of it in an amendment may not necessarily be non-germane. I saw here Representative DeLamus, you wish to speak?
Yes, thank you, Mr. Chairman. Actually, I'm just going to chime in on Representative Merchant's amendment and say that I really like it. I think I like it because the patient can request the pupillary distance. And I did request pupillary distance from my ophthalmologist when I went to get my prescription, which I actually have in my pocketbook right now, and that pupillary distance box was empty. And as I said before, that I had to go sneak in to the other side of the thing, and I had a friend that actually does the measurements and did my eyes for me. But if the doctor had just given me the distance, because I can't see. If I take these glasses off and I take a ruler and I put the ruler up to my eyes and I'm trying to see the distance between my pupils, I'm like, I can't see a darn thing. So I would trust a doctor can actually like maybe put a ruler up there and give me the distance upon my request. If I don't feel I need it or I don't want to get it from the doctor, the prescriber, then I don't need to ask. And the reason that I did ask was because I did buy these online. Thank you.
Representative Gay.
Thank you. I really like the Merchant amendment because there's two categories of people who would be interested in not going to the glasses dispensary that's at the doctor's office. They are either going to order online, and we all understand that that's not ideal, but that's financially for people who either don't have the money to order it or don't have Lions to buy the glasses for them. That's where they are. They've got to order it at something they can afford. They need that pupillary distance, which takes, 10 seconds to make. of the other person who's going to go to a cheaper place to make their glasses. They don't need it. And now they have gizmos that are so quick. When I was waiting after my surgery to get these $700 or $800 glasses, I went and got some El Cheapos for $100, and they, these are not highly trained people, and they measured me with a cute little gadget. So I think it's really important to guarantee that people have the right to get that pupillary distance, because not everybody can afford what most of us can afford. And so I think it's very prejudicial to say, oh no, you're not getting the Cadillac. We need to make sure you do.
Representative Weber.
Just as a matter of clarification to my original point, yes, fitting contact lenses was in the original bill, but it was a replace all. The language in the original bill is exactly the same as the existing statute, and we didn't talk about contact lenses at all. It was, I believe it was put in there as a way of getting from Section 1 to Section 3, which did have the addition of the interpupillary distance. So I'm still concerned about the contact lens section.
Representative Leon.
Thank you, Mr. Chairman. While I am concerned about asking different professions to cross-train, we can measure our own interpupillary distance if we can see ourselves in the mirror. So I do like the Merchant Amendment, how it can be modified and making it so that it is more flexible. And if that's the way we ended up going, I'd be quite fine with that.
Are you withdrawing your amendment? Or you're just happy?
There's different ways to skin a cat, and it's hard to say that a professional can't do what we can do with an app or a ruler.
I wouldn't skin a cat if I was a professional, but what would you like to do with your amendment?
Well, I guess I haven't submitted my amendment yet. All right, we haven't made a motion or anything.
We haven't. And what
Hold
I'm
on.
asking is, do you want us to?
I see a hand over there. I don't know if.
Representative Knurk.
With respect to the issue of the contact lenses, although it was not part of the original bill and was not noticed as such, we did have testimony about the contact lenses. That's Rosemary Rung's amendment that she brought in. And what Representative Leon did was take her amendment and blend it. So it was covered in testimony, though it was not a notice thing. Yeah, so I think it's okay. Okay, germane-wise, I mean.
Representative Gay.
Is there any reason we can't adopt both of these amendments?
No.
Yeah?
No.
Oh, because
They're-
one
they're in
says yes
conflict.
and one says no about the pupillary distance?
I will, if it's okay, I would like to make a motion on Amendment 2022-0963H, which amends House Bill 1139.
And you would like to make that motion
Yes.
that it is ought to pass, I bet, right?
Motion to pass, and then hopefully,
I bet it is. And wait a minute, we're getting there. Let's see, we've got so many amendments and not as many as the Constitution yet. Okay, so there's Merchant O2P. And who would like to second that? Representative Weber. Okay, speak some more, if you wish. Or not.
I'll just call the vote.
Ooh, call the question.
Call the question.
All right, any objection? Anybody else? Good, thank you. The question before us is Amendment 2022-0963 to House Bill 1139. Moved by Representative Merchant, seconded by Representative Weber. The motion is ought to pass. And the clerk, please call the roll.
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow. Yes. Representative Knirk.
No.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
No.
Representative Merchant.
Yes.
Representative Pearson.
Yes. 19
19 to 2.
to 2. Now, you're not going to move You're not. Okay, so we move to the bill now. And we have before us House Bill 1139 as amended by 2022-0963. And I have nobody in my script, so this is a free-for-all. Who'd like to move this bill as amended? We all know the answer to that, but I need to hear it from himself. I knew it.
A motion to auto pass with as amended.
And somebody from over here, Representative Kelsey's hand reached to the sky
Well, you
quicker
know,
than anyone else's.
there's somebody over there who hasn't gotten to second anything.
I have a question.
Are we in the voting mode right now?
I was waving before the voting mode, but
Oh, see,
I could wait till after.
It was my interpupillary problem here.
Eyes are crossed.
Would you like to say something?
Well, the amendment, may I?
You may.
We just passed the amendment,
Yeah.
and it goes into effect January 1st, 2023.
That's next year.
Okay, but the bill goes into effect, which we're probably about to pass, 60 days after passage. So I wondered who took precedence, because I think sooner's better than later.
Well,
It's
the amendment changes the effective date.
Okay, thank you for the answer.
And this was to provide an educational opportunity from the various licensing boards to educate their licensees about the requirement in the statute and not spring it upon them within 60 days.
Would the clerk please call the roll on House Bill 1139 as amended by Amendment 0963H, moved by Representative Merchant and seconded by Representative Kelsey?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas.
Yes.
Representative Snow. Representative Knirk.
No.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
No.
Representative Merchant.
Yes.
Representative Pearson.
Yes, 19 to 2. We've seen 19 to 2s appear on consent if there is no objection to consent. I see no objection to consent. Well, that means, Representative Merchant, in gratitude for all you've done, this amendment, your cheery demeanor, you get to write the blurb. Brother, thank you. You know what the reward for a job well done is, don't you?
Yeah, no good.
More work.
Deed goes unpunished. Yep.
Which year do you want those blurbs?
2023 when it's effective.
And that concludes the exec session on 1139. And I open the exec session on, just make sure I have not been asked to do this tomorrow. I have not. House Bill 1488, expanding the prohibition against discrimination based on an individual's election not to participate in the state vaccine registry, a bill of Representative
Yeah, thank you.
Prout.
I think I have them all by heart, but some of them I don't have. I have a lot of them in my head. I used to not be
Let
able
me
to
look,
do that.
11, what number is it?
1488.
1480, let's see who's in the script. 1488. I have Cushman.
Yeah, this does nothing. The comment was that daycare. What?
House Bill 1488. And if you look at it, it is remarkable in its brevity. Line 2. No healthcare provider, here's a change, or any other entity identified in paragraph 4. Well, I looked it up. And a number of people are listed in that paragraph 4. Primary care physicians, nurses, other appropriate healthcare providers, schools, child care agencies, government researchers. None of those, therefore, according to the bill, if passed, shall discriminate against any person solely because that person elects not to participate in the immunization registry. That's the bill. Any discussion, questions? Oh, Representative Woods.
Just not that people haven't read it, but it's the registry, not the vaccination. And other people have contacted me with that misunderstanding. So this is just the non-participation in the registry, not the non-participation in vaccination.
And for the record, 253 people signed in favor of the bill and 47 against. Anyone else? Looking for someone to move the bill? I've got Representative Cushman in my script to move the bill, unless we have somebody on this side of the playground who wants to. All right, somebody's blurbed up. If not one Gary, how about another Gary? One Gary, Gary Woods will do that. Now we go over to this side of the playground, and Representative Acton, yes, Representative Woods, also known as the blurb writer. Any further discussion?
Acton.
For clarification, I've been notified that I said yes, but I was not clear what I said yes to.
But we thank you heartily.
Yes. So
And you get to write the blurb, which means you move the question OTP.
That's correct.
Is that good?
Yes, I'll do my best. As I said, not being a writer in my physics background, the only thing I learned to write were equations, so I hope you'll all be able to understand it.
We just don't want to read the blurb and think chaos.
It will.
The bill before us is House Bill 1488, moved by us on behalf of Representative Woods and seconded by Representative Acton. Please, would the clerk call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative, Frida, sorry. Yes. Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21-0.
Gosh, is there any objection to this going on to consent? Seeing none, it's on to consent, and thank you, Representative Woods, for the blurb.
I'll make my blurb short. E equals MC squared. How's that?
We want it positive and not relative.
Yes, yes.
They'll make it with positron.
And this concludes the exec session on 1488, and I open the exec session now on 1271. 1271. Do I see any amendments? I do see an amendment. You have an amendment. Oh, we're going to ITL it. All right. We don't have to study it. The chair calls on Representative Leon for a motion.
Thank you, Mr. Chairman. I'd move interim study on House Bill 1271.
And do we have
second.
We do. That was Representative Merchant, who's happy to speak if he doesn't have to write another blurb. Okay, wonderful. Thank you. Representative Leon, defend your motion on interim study, please.
Thank you, Mr. Chairman. I think that we had a lot of good discussion around this. There are a lot of open issues around that section that was added to law. But as we move out of this emergency, figuring out how to change it so that we don't get rid of the protections that were afforded and don't cause more confusion by getting rid of this now seems to be the best way to do this. By doing an interim study, we can figure out how to address these sorts of things going forward and how basically how to address the concerns that were raised in that hearing. But right now, there's nothing that we really need to do because that protection was afforded during the COVID crisis, and trying to figure out some way to pull that out right now just isn't the best way to go. So interim study is my preferred path.
Any discussion?
No, I just want to say, Representative Leon,
Representative Merchant, please.
I second your comments. Well said. Thank you.
Wow. Yeah. Okay. Seeing silence, hearing silence. The motion before us is interim study on House Bill 1271, moved by, who moved it? You did. Okay, my name was in here. That means I don't have to write the bill now. Thank you, God. Moved by Representative Leon and seconded by Representative Merchant. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow. Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro. Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21-0.
Is there any objection to it going on to consent? I'm learning how to do this without being prompted. Seeing none, it's on consent. Thank you, Representative Vice Chair, for the forthcoming blurb. I make it, we're up to 11. Done? Is that what you have? Anybody keep scores?
I have to write this down.
You have to write it down. Yes, you do. Wow. Maybe we have 12. We have 12? Okay. That concludes the exec session on 1271. And I now open the exec session on 1495. No, that was an old note. Thanks.
Okay.
Thank you, though.
Yeah, we had voted on that one, I think, before, Mr. Chairman.
1495 with an amendment coming your way.
1495 is with the government contractors?
Yep.
Okay, thank you.
Everybody have one? Because I think I have two of them. They're coming. This is an extra one if anybody doesn't have one. I mean, it's an extra one even if they do. Think about it. And on this bill, as originally proposed, we have 435 people in favor and 144 signed in against. 435 to 144. Wow. Yeah, we can. Representative Leon, would you speak to the amendment? It really shortens the bill.
Thank you, Mr. Chairman. This may seem like a very large pivot from the bill, but almost all of those words are included on page 1, lines 3 through 9 of the original bill. Because this now prohibits the state of New Hampshire and its political subdivisions from requiring businesses to check this, the word customer was added as well, so that the state or any political subdivision, if things follow what we have in this committee on the floor and we keep the medical freedom and immunizations, then no, it would not be necessary. But if the medical freedoms and immunization is removed, which is a possibility on the floor, then this would be necessary.
Great answer. Any other questions, discussion? Representative Gay.
Is this a substitute or just for one paragraph? Is this a, yeah, does this replace the bill or?
Look at line 6.
Okay, thanks.
Representative Weber.
I'm just needing a little bit of a clarification. It says the state's not going to require any business to require a check for possession of any documentation of certifying vaccination or immunity status. I know that the federal government requires all airlines to check those things. So I'm just a little concerned about, this shouldn't have any problem with that because that's federal, this is state. I'm just wondering if there are any circumstances where this would be inappropriate. I certainly agree it simplifies matters enormously and it preserves the rights of private businesses, which I'm for. It's just, it's a huge leap and I'm trying to get my mind around it.
Representative Leon, would you choose to answer, please?
Yes, thank you, Mr. Chairman, and thank you for those question statements in order to clarify this more. This simply says the state and its political subdivisions can't require that. It does nothing to stop the federal government from requiring it. It does nothing to stop CMS from requiring it. All it says is that the state can't put this mandate on businesses, or the state or its subdivisions cannot.
And a follow-up question? if I
Follow-up,
may?
yes.
Could you remind me what RSA 141C20A is?
Yes, that's childhood immunizations. So a
Okay.
child care business, a child care facility can still be required to check for that immunization status.
Okay,
So this
thank
is
you.
COVID specific.
Thank you very much.
Representative Snow.
That answers one of my questions, and the second was, this does also not stop any
Representative
Just gave me
Freehas,
a
you are the
tutoring lesson on
custodian
how to
of
do
the
this.
microphone for
and I've
Representative Snow.
failed. This also does not stop any business from doing this on their own, is that correct?
That is correct. It just does not does not make the state an agent to force them to check for this.
Thank
They
you.
can do what they choose.
Representative Knurk.
I'd like to hear from DHHS regarding accreditation issues because part of their accreditation is to check that a facility is following federal mandates. Granted, this is still a federal. I know it's a federal, but the state is the one that actually accredits the hospital or the nursing home and makes sure that they are following the appropriate mandates. That's what they told us before. So I would assume either perhaps Paula Minahan or John Williams could clarify for us, will this interfere with the ability for us to get accreditation of our facilities because they would not be able to do their accreditation work because they couldn't ask about whether or not they're doing vaccinations to be compliant with the federal mandates?
They're consulting, and
Yes, I see.
one or both, and maybe even Abby Rogers for the hat trick would come up and enlighten us. Wow.
Can I first see the amendment from someone, please? Because I have not seen it.
They're having a caucus. Not a problem. Use this time to think of the committee amendments you're going to be writing. Let them, they'll. One of the three is at the table, one fled, and Ms. Rogers is in motion.
Oh, good.
I did ice hockey play-by-play at college.
Abby, you go.
Hi, members of the committee. Abby Rogers, Legislative Liaison for the Division of Public Health Services. I'm just going to take a second to review the bill. I believe that John Williams is reaching out to Joe Christie, who's the CFO of New Hampshire Hospital, to get his take on.
We didn't scare him off.
No, he'll be back.
Okay, good.
So to answer Representative Knirk's question, if this prohibits the state of New Hampshire or its political subdivisions from requiring any business to check or to require or check for the possession of any documentation for certifying vaccinations or immunization status. So the question really has to do with the hospitals that are, and the nursing homes that fall under survey and certification under the Department of HHS Health Facilities. And the requirement will be for them to ensure that the hospitals, I'll just speak for the hospitals, but I think nursing homes fall under this, that the department, while they certify, they have to, or go through the certification, they have to make sure that they're following the CMS policy. So they will say, show me your policy. That requires you to ensure that they are vaccinated or have been given the opportunity for an exemption, et cetera. And I believe you're right. I believe that any documentation will be how you verify that, that they have in fact documented that they're either vaccinated or that they have received an exemption. So I think Representative Knirk is correct, the way I read it, that this could be in conflict with that requirement of the state that does these certifications, the CMS certifications.
Representative Leon, respond.
Thank you, Mr. Chairman. When I was looking at these with the co-sponsors, this doesn't prohibit them from checking whether they're compliant with other requirements and other regulations. It's simply not allowing the state to be the one telling them that they need to check for those vaccinations and documentations. We don't believe that it interferes with their right to verify if they are, in fact, following other requirements.
Representative Knirk, follow up?
But it says explicitly that it shall not require any of them to check for the possession of any documentation. And that's precisely what accreditation is all about, is checking to be sure that they have done that. That is the job. That's why I brought that question up. And I think it does create a conflict in the statute.
Representative Merchant.
I hear what you're saying, Representative Knirk. I read it somewhat differently because the way I see this is they're not requiring the documentation based upon a state request or state requirement. They're doing it based upon a federal requirement. So therefore, when I read through this, the political subdivisions shall not require any business or to inquire or check on the possession so for documentation, but that's at the state level versus trying to be sure that they're complying with the federal level.
Representative Knirk.
But it is the state level at which accreditation is carried out, and that is the problem because that is what they do. They go in and they say, show us your policies, show us these things. That is how we accredit you. So they're not actually helping the federal government with compliance at all. They're simply accrediting the institution, and to accredit the institution, they must check that documentation. And they're not checking it as a federal requirement, they're checking it as a state requirement for licensing. That is a state requirement, and that's why that's happening. That's why there's conflict.
Representative Cushman.
Thank you, Mr. Chairman. I'm in agreement with Representative Merchant. The way that I read this is that it just can't be a dictate coming from the state. This business needs to require or check vaccination status of anyone, and that the businesses, if they want to comply with federal regulations and they're seeking certification, they can do that, but the state can't tell them that that's what they need to do.
Representative Knurk, you're on a roll.
This is my last one. Regardless what you think it means or the other sponsors think it means, I think we really ought to listen to the people who actually are doing the accreditation and how they would interpret it, and that's why I brought this question up. And so I think that we still have I know you weren't trying to make a difficulty, but I think it does. That's my concern.
Anything at this point that Ms. Rogers, Ms. Linehan wish to say at this point?
Sure. I would say that I represent public health services, so technically accreditation is not under my purview for the department necessarily, but I can say I do agree with Representative Knurk that it does seem to propose a little bit of a conflict with that, with the certification having to ask business or employees of said business, especially if they're a healthcare business, whether there is a vaccination status in place if that's required to do their business and required by licensure.
Okay. Representative Folsom.
Thank you. There's nothing in this that says a business can't require that. It just says the state can't require it. So if you're a hospital or a nursing home and you know that CMS would like you to do this if you want your money, then they choose as the hospital, yes, we are going to require that of our employees because that's what CMS is requesting. So it's not the state telling the hospital and nursing home you have to do that. It's a decision made by the hospital to follow the CMS guidelines.
Except the state, and that's probably not the right term, but they are kind of agents of CMS when it comes to survey and certification. They contract with CMS to survey the nursing homes and survey the critical access hospitals. We're not talking about all our hospitals. We're talking about the critical access hospitals because they use the health facilities licensing CMS certification. It is a CMS certification. So that's the same concern that I have with 1455 that got passed as is. The speaker's bill, that was our testimony in that bill, and I think it's still flawed because it is going to be a problem. There's going to be a conflict, and I think the agency is going to be have a trouble unless it's clarified in here that nothing in this in this paragraph, and I probably can come up with some language, but nothing in this paragraph would prohibit that from occurring. Because again, I don't know if agent is the right term. I'm looking at Representative Weber. Maybe that is the right term. But they are acting on behalf of CMS. They have a contract. So that's why it causes a conflict. It does. I think it does.
Representative Weber.
I haven't seen the documentation, but it sounds to me like it's an agency relationship. And I was, when I first started thinking about this, I was wondering if there was a way to say, well, I was instantly thinking New Hampshire Hospital and the county nursing homes, and I thought, well, maybe if we just insert the word private business here, that would take care of it, but it doesn't because some of the hospitals are not state-run hospitals. So I don't know whether you fix it by putting the disclaimer that you're talking about in so that those evaluations can continue to take place, or whether you carve out hospitals, nursing homes, and medical facilities, which probably doesn't fulfill the intent of the people who proposed it. I mean, I'm trying to figure out a way of having it apply to all those businesses. I mean, I love the idea that the business is given the right to decide what they're going to collect, and people can work there or people can work somewhere else, and that's all good. Or people can attend or not attend. I was wondering if, and now I've sort of lost the thought, but I was thinking of a carve-out, but I'm increasing, the thing I'm wondering about is, are there other businesses that might be in the same state, that might need the same kind of carve-outs, and I can't think what they are because I'm here on the Health and Human Services Committee, and the hospitals and the nursing homes are what come to my mind.
Federal
So,
contractors possibly. Yeah, I feel like we're at a disadvantage because we're just
Well-
seeing this amendment right now. And I need to think this through a little bit more of the unintended consequences potentially.
Representative Weber, continue.
I think I was kind of persuaded by Representative Leon that if the mandate comes solely from the federal government straight down onto whoever it's falling on, that comes from the federal government and this doesn't cover it. I think the time we get into squishy territory is this specific instance where because of the contract with the federal government, the state is the enforcer of requirements that come from the federal government. So I think the state is in many ways mandating it, even though it was originally the federal government that did it. So whether it's a carve-out or whether it's clarifying language, I think I would be a lot more comfortable if we went that direction.
Mr. Williams, do you have news from the front?
Chairman Pierce and members of the committee. Regrettably, I usually come through, but I could not get a hold of either Mr. Joe Caristi that testified before this committee on the underlying bill from New Hampshire Hospital, or Nathan White, who is our director for our procurement unit. I can try to get information to this committee on whether or not there are any issues to the bill. We do appreciate the work that was done by the committee, I think, to try to address the concerns. I just can't independently, without confirming with either one of those two gentlemen, that this doesn't present any problems for the department. I did earnestly try to get a hold of them. One is out of the office today and tomorrow, and the other one I will definitely continue to track down.
You know where he lives?
I do.
Okay, that's all I'm asking.
Thank you.
Representative Gay.
Thank you. How about where it says, in line 14, where it says, except as specified in RSA 141C. I didn't look up 141C, but because it's already giving an exception, how about except where required by federal law?
You are addressing that to whom?
Everybody.
Anybody? Representative Cushman.
Thank you, Mr. Chairman. Just a couple of points. So I've gotten testimony from the president of the American Association of Certifying Agencies that is basically like a union, a professional organization that represents all of the Medicare and Medicaid CMS certifying agencies across the country, and in the states where they have bills similar to 1455 that we just passed and 1604, where they will not be certifying based on certain requirements, such as the vaccine mandate, that they've just continued to certify, and it's, there have been no negative consequences from that. I also don't see why our state agencies couldn't just say, the state isn't legally allowed to require this, but if you want to meet the federal requirement, you need to provide this kind of policy.
I have a question for the principal amendment writer. Would it be your pleasure to try to keep what we have and vote it however we will, or would you like to bring in something tomorrow as another amendment?
Thank you very much for that. I think that let's see. We'll consider it overnight and either bring this back up or bring another amendment tomorrow.
So what you're suggesting is we should now move towards recessing this and not come to a decision.
Yes.
Representative Knurk.
Just one last comment while we're thinking about this question, though. I think it's important to remember that we've had a lot of bills that came in based upon COVID-19, but the changes they make are sweeping and for the future. And one of the big problems is ever trying to legislate public health responses because they need to be nimble and fast, and legislative process is intentionally rather slow. To remember, this doesn't say anything about COVID-19. This would be anything. So if we got some other kind of incredibly horrendous pandemic of some sort, respiratory is the usual type of thing we have to think of, this would not allow our public health agencies to have the flexibility that they might want. Not that they would. If we think about it, in this, which was the biggest one for our lifetimes in a century, the state was not mandating the businesses do vaccinations. I very much doubt they ever would, but I'm not sure we should be prohibiting and tying the hands of our public health people for a highly unlikely situation. But if a highly unlikely situation comes, we don't want them to say, sorry, we can't do anything about this. So I would still lean toward just simply ITL on the bill, rather than trying to parse this to become a little less troubling, because I don't think we actually need it anyway.
Representative Leon.
Thank you, Mr. Chairman. While I appreciate that there's a question of what's around the corner, back before I was a representative, I came and testified at one of the emergency powers hearings. In that one, they were talking about any excess supplies. The way it was written, food beyond that day, your child's medication beyond that day could have been confiscated. 3 bicycles with 2 people in the household, that third bicycle could be confiscated. So it's our job to make sure that the response is in keeping with the demands and that we do have reasonable limits that our agencies will work around. I'm convinced that in an Ebola pandemic or anything like that, the businesses themselves would be requiring this added protection. And in something that is far more virulent than COVID-19, I don't think we need the state to act in order to get people to follow through. But I just, instead of moving forward on this, let's recess it and try and get through a few more bills. Thank you.
All right, the chair accepts that suggestion, and we are going to recess on 1495, but we will be looking at it tomorrow. I opened the executive session on 1409 relative to the age at which a minor may receive mental health treatment without parental consent. And you may remember, yes? An amendment. We have an amendment. Is that 513 amendment?
Oh, but he also wants to make an announcement.
And Representative Shapiro. I can't hear you, sir.
Thank you. This is not specifically about this bill,
Okay.
but since we've had so many bills that involve consent and confidentiality for adolescents in terms of vaccines, and this one in terms of mental health center, I came across an adolescent and young adult health care in New Hampshire, a guide to understanding consent and confidentiality laws. Done by a national organization. So I've made copies. There's not enough copies for everybody, but I'll leave the copies by Representative Folsom, and if anybody wants one, feel free to take it.
Thank you very much. Coming around is Representative Weber's Amendment 0513. And when we've all had a chance to look at it, we'll ask you to walk us through it. I have one. And on 1409, 49 people signed in favor of the bill, and 152 signed in against this bill. 1409. Do we have more 1409s, amendments coming around? Anybody have a spare amendment?
Did I get one?
I don't know.
She'll make them.
She's gonna make a few. Boy, I'm gonna miss having a photocopier next door. Does everyone now have a copy of Amendment 0513? It's a quick read. And would Representative Weber explain her amendment?
Thank you very much. You remember that when House Bill 1409 came to us, it had long and complicated provisions on how treatment was going to be paid for and what insurance was going to cover, and there were terrible unresolved questions with how one maintained confidentiality with a minor when their parents were going to be presented with an explanation of benefits. So this dodges, frankly, all of those questions by simply stating, and as Representative Shapiro can speak more about the state of stuff as it is right now, but it's a little unclear. So all this does is it says that a minor who is 16 or older may voluntarily consent to mental health services, so that's the minor may consent, and a licensed mental health care provider may provide the services without the consent of the parent or guardian, provided that they're not going to provide medication. So for the kids who cannot go to their parents because their relationship with their parents is not such that their parents are already helping them look after their mental health, which is, of course, what we want for every child. It allows a kid who needs help, is 16, to go and get that help. And it balances the interests. You know, we heard a lot of concern when we had the hearing of, you know, my kid may be taking a medication that I know nothing about, and heard that concern. So we limited it, strictly speaking, to talk therapy. So it clarifies that the kid may and that the practitioner may, and doesn't go any further than that. So with that, I would be glad to offer Amendment 0513, and the committee can do with it as they please.
Representative Folsom.
Thank you. Just a question of some wording that kind of throws it in two different directions. You just spoke of a person, a minor 16 or older, could seek out help. But the way it's written here is they're not seeking it. They're consenting to somebody else who has decided they needed counseling.
Consent,
Weber.
consent is a legal term of art, which is used, generally speaking, for who may agree to services. Either, you know, if I go to the hospital, I have to consent for them to treat me. If a kid goes to the hospital, generally speaking, the parent or guardian consents on behalf of the kid. So this is not implying that somebody's coming up to somebody and going, hey kid, you want to have some mental health counseling in the back alley. This is actually the legal term that we usually speak of for somebody approaching a mental health counselor. And you either agree that yes, it's a good thing for 16-year-olds to be able to do this, or you don't. And I know that there are many varied opinions on that, but I think the drafting probably should be okay.
I spoke with the prime sponsor of the bill, and it is her assertion that she eventually, incrementally, would like to move the age to 12. In fact, a bill that she previously filed, I believe, had that age in it. And I would also say that there are many steps that were not mentioned between going to one's parent or not and going to a mental health counselor. So many kids who just want to talk out something go to a member of the clergy, a coach, a teacher, a friend, whole variety of people who may not be licensed mental health counselors, but people who need to talk things out can go to them. However, I think when we get to the level of the mental health counselor, the professional, licensed, trained, people who then would want to go to such professionals, I would think don't just have a little thing they want to talk through. They got a big problem. And I have to look at that big problem in that why they cannot talk with their parents may speak of something that is systemic within that family that may warrant further intervention. What this does is short-circuit it. It keeps secrets until they're exposed, and then, oh my gosh, the secrets have been told to others. I see this as the erosion, not the helping of the family system, being fully well aware of some pretty bad families. Anyone else? Representative Snow.
Thank you, Mr. Chairman. I do think the other issue is a kid, whether it's 12 or 16, I hope it doesn't go back to 12, because that, to me, is a big problem. But if it is 16, 16-year-olds are ordinarily under the family's health insurance policy. If they're going to go to a professional counselor, they're going to have to request that they're going to have to give the information about their insurance, and the parents will be getting the information that it's being paid. And I don't know if Medicaid, some of them are going to be covered through the Medicaid system. I'm assuming that the youngster can do it, but whether or not that requires the parents to request that it come under their Medicaid coverage, I think remains to be seen. But it is kind of a complicated issue within it. I do remember talking with the representative who sponsored this bill and raised questions about whether this can be any way tied in to the emancipation of minor bills, which are in. That's a court proceeding where essentially the child essentially divorces his parents and can make adult decisions on his own. But again, it leaves open the problem of how does he cover the cost of this policy. And so far, none of that's been, I think the assumption is you can go, I could agree to see him, but I have to understand I might not be getting paid for what I'm going to be doing.
Exactly. And that
Representative Shapiro.
Yes, I think this bill is very limited in scope purposely because those other issues like payment are so complicated. I would say that as in most of the bills that we have competing benefits and consequences on both sides. And while I don't tend to use the term parental rights because I think parental rights are also parental responsibilities, and it's not like parental rights to me implies like ownership of our kids a little bit, and I don't think that's what people mean when they use the term. But I do agree with Mr. Chairman, with your thoughts about wanting to, this is the kid's family, and as much as we can help the family work out problems, this is for the best. However, I think on the other hand, the competing benefits and consequences are that there are some young adults, adolescents, who do not have parents who, for various reasons, are able to provide the proper guidance and support and help. And this would allow those kids, those 16 and 17-year-olds, not easily, because this bill doesn't make it easy, but potentially to access mental health care. And I have a list that was handed out during testimony. I would say that half the states, about 25 out of the 50 states in the United States, allow for adolescents to access mental health care without their parents' consent. Some as young as 12, but many are 16, some are 14. It's all over the place. But this is not an uncommon phenomenon.
I would just ask the representative, I've done a fair bit of counseling in my capacity. You've done it as a professional licensed counselor. Do you see that most kids are bereft of having a coach, a teacher, the guy at the drop or gal at the drop-in center that people can go to if the parents are not the ones?
Well, what I would say is that one of the main factors in how kids do is whether they have they often use the term charismatic, but a caring and concerned and someone who's willing, an adult that's willing to come forward, even if they don't have the family supports, that having an adult who is available to them, really available to them, is one of the main factors in how kids do as they come into adulthood. And I think this just, some adolescents have those other people. They have a coach, they have somebody at the Boys and Girls Club. However, it's kids from families who are having a lot of problems who tend to participate less in those activities, church, religion. So I think I would not say that those other adults are unimportant. I would just say that this adds another resource for 16 and 17-year-old adults to get help when
Thank
they're
you.
hurting.
Representative Knurk.
Yes, and I would agree. I think that's the issue, is that it'd be a rather small number of kids who would actually do this. It would be that rare child who does not have anybody that they can turn to. And it's also important to realize that a coach may be great to teach you how to handle a soccer ball, but they may not be the best person to talk to if you are being sexually abused by your stepbrother. That just may not be an optimal person to go to have that conversation. Now, the thing is that the issue, yes, we cut out all the reimbursement. That can be a problem, but charity care has been provided by providers for hundreds of years. And I think if you had a provider who had a child come in that was really in trouble and sought care, they probably, I think a fair number of them would be willing to treat a small number of those kids for a short time, if necessary, and then try to engage the family. I think just about every good provider would try to engage the family ultimately. And there was another point I was going to make, but I forgot now what it was.
Representative Shapiro will buy you some time.
I also want to point out that this is, potentially an added resource for teens and a protection for teens. But it's also a protection for clinicians who want to provide this care. I think the landscape now is incredibly unclear about what the age of consent actually is. And this would just make it clear that if those mental health clinicians chose to, that they would have some protection in working with an older adolescent.
Representative Snow.
Yes, I want to remind people, I believe most of you may have been present, whether or not it was this year or during the last session, that we had some very meaningful testimony by a young woman who at the time was a student at UNH. But during her last 2 years of high school, she was very depressed, considered suicide from time to time. And her parents, because of being embarrassed by having a child with mental problems, refused to allow her to have any contact with a mental health professional until she got to UNH, where she did have access to the. Do you remember hearing that testimony? And I think when it gets to the point, that woman sounded like she was the kind of trouble that a coach or a friend is really not going to be a great deal of help for. And certainly, I worked in the business for a long time. I think if a child that young, I'd take the risk of trying to see them. And I think most people would. But I agree with him that this bill, if it passes, would tend to clarify that a little bit. But I think most people, if they thought they were going to be able to prevent a suicide now, one of the things that often happens when you see them is you usually want to start them on some sort of medication. And at that point, I do agree with her that we would have to involve the family at that point. I think that would be irresponsible. But leading up to that point, maybe if you at least make that first gesture of sitting down and seeing them, understanding the problem, making sure that they know that you as the counselor are on their side and want to help, that they may be able to listen to you about taking other steps that might improve that degree of help. So I don't know if I'm making any sense, but I do think this is a very serious issue, and we do have to think about kids. I'm still opposed to lowering the age much below 16, but I would be comfortable with this under those circumstances. And I think we have to use common sense. Some things are just very serious, and we got to take them seriously.
Representative Knurk, have you rediscovered your second point?
I figured out why it left my head. It went sucking right down to Representative Snow, because that was precisely what I was going to do, is harken back to that desperate woman who was unable to get help when she was under 18. Thank you for doing that, Representative Snow.
Representative Merchant.
Thank you, Mr. Chairman. This also allows, I think, for a school psychologist to speak to a minor who probably needs some therapy for whatever reason. And I think, again, back to the same thing, we're not trying to destroy the family, we're actually trying to repair it. The students here, I only can share with you from my wife who's a school nurse, there are many times in which a child needs help, but the parent is the barrier to it. So I don't think this bill is trying to destroy the family unit. I really think it's trying to repair the family unit that has been destroyed, and allowing healthcare professionals the opportunity to talk to a child at that age to try to help them understand that the parents really aren't that bad. They're just trying to look at life differently and try to find a way to bridge the gap between the minor and the parent is going to be critical.
Representative Cushman.
Thank you, Mr. Chairman. I have to acknowledge that, you know, there are some cases where parents do not provide what is needed for a child. But again, we circle back to the issue of taking away the rights of some because of a few bad actors. And I have concerns about a minor, 16 years, 17 years old, being alone in a room with someone without their parents' knowledge. I think it puts them in and that person in a dangerous situation when the parents are left out of that.
Representative Gay.
Thank you. I discussed this with my daughter, who is the parent of two older teens, and she immediately said, "But Mom, there's too many kids who don't have responsible parents." And so, you know, I feel torn in both these directions, but I don't think I would have had to fear if my child went to the counselor. And I know in Salem, I'm told that it's the kids, the counselors have the right, the fact that the child's in school, they have the right to see the counselor there. They don't need a written pass from the parents. But I also know that the counselors are way overworked and have way too many kids. And if you listen to Judge Broderick, a lot of kids come to him every time he goes and speaks at a school, wherever. Tons of kids come and tell him that they are so troubled. So I'm going to fall off the fence on that, on the side that I would rather that they see a counselor, and you certainly hope that the counselor is responsible and does everything they can to do the family repair that's needed.
Representative Weber.
May I make a motion?
The chair is going to make a motion.
Okay.
The chair makes the motion inexpedient to legislate. Seconded by Representative Kelsey.
May I make an inquiry of the chair?
You may.
So the motion is inexpedient to legislate. So if I want to pass the bill with the amendment, I need to vote against the ITL and then bring a motion on the amendment. Is
That
that
is correct.
Thank you, sir.
Representative Shapiro.
Yes, before we vote, I would just like to say that I know that some people are going to view this as taking away something from parents. And I would just ask people to understand that people who have an engaged, positive, maybe not 100% positive, but an engaged relationship with their adolescent children, there's going to be discussion with their adolescent children before they go to therapy. This is not going to create a wave of people running away from their parents to secretively secure therapy. People who have positive, healthy relationships with their kids, this will be discussed. And probably the parents will go with them to therapy the first time and introduce them to the therapist.
Or there'll be a family systems.
And perhaps there'll be a
Sure.
family systems person who works with the whole family, which is a very good thing. So I hope people will not view this as only taking something away or taking rights away from parents, but offering a resource for some kids for whom this might be a lifesaver. Thank you.
Representative Knurk.
Mine's more a parliamentary inquiry. On most
Sure.
of the bills today, if an amendment was offered, we took up that amendment first and voted before we then voted on the bill. And here we're going straight to ITL. I know we could do that, but would it be kind to go ahead and consider the amendment first and then move on to the bill? I've been overruled by my ranking member. Thank you.
Anyone else wish to speak? Once again, I would reiterate the fact that there's a lot of steps between talking with one's parents and needing to engage a professional, licensed, credentialed mental health expert. Many people do have a coach, and some coaches coach soccer and not kids. But there are other coaches, or teachers, or clergy, or Boys and Girls Club people. And if it gets to the place where they're just not able to do it because the problem is so great, then we do have a great situation in that family. And to keep the parents out of that loop at that point may well make it worse. So I do not see this as being of help.
A parliamentary inquiry?
You may.
So if somebody wants to ultimately vote for the amendment, right now, because the ITL motion is before us, we should vote down the ITL so we can get to the amendment.
This is correct.
Thank you.
Further parliamentary inquiry?
You may.
Has there been a second?
There has been. Yes, there has been.
And who seconded?
Representative Kelsey has
Thank you.
seconded this. Okay. The motion before us on House Bill 1409 is inexpedient to legislate, moved by the chair, seconded by Representative Kelsey. The clerk may call the roll, please.
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber.
No.
Representative Freitas.
No.
Representative Snow.
No.
Representative Knirk.
No.
Representative Query. No. Representative Cannon. Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No, there we go. No.
Representative Merchant. Representative Pearson.
Yes.
10 to 11, the motion
10, 11, the
fails.
motion fails. The chair recognizes Representative Weber for a motion.
Thank you, Mr. Chairman. I would move Amendment 0513.
And do we have a second? Representative Nutter Upham. Any discussion? Seeing none, the motion before us is on Amendment 0513, ought to pass, moved by Representative Weber, seconded by Representative Nutter Upham. Would the clerk please call
Yes.
the roll?
Thank you. Representative Leon. No. Representative McMahon. No. Representative Acton. No. Representative Gay. Yes. Representative Cushman. No. Representative Folsom, no. Representative Kelsey. No. Representative King. No. Representative Kofalt. No. Representative DeLamus. No. Representative Weber.
Yes.
Representative Freitas.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
No.
11 to 10 it
The
carries.
amendment carries 11 to 10. The clerk recognizes Representative Weber for a further motion.
Thank you, Mr. Chairman. I would move ought to pass as amended by Amendment 0513 on House Bill 1409.
And do we have a second? Representative Nutter Upham. Any further discussion? The motion before us is on House Bill 1409 as amended by 2022-0513. The motion is ought to pass as amended. Moved by Representative Weber, seconded by Representative Nutter Upham. The clerk may call the roll.
Representative Leon.
No.
Representative McMahon. No. Representative Acton.
No.
Representative Gay. Representative Cushman.
No.
Representative Folsom, no. Representative Kelsey.
No.
Representative King.
No.
Representative Kofalt.
No.
Representative DeLamus. No. Representative Weber.
Yes.
Representative Freitas.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods. Representative Merchant.
Yes.
Representative Pearson.
No.
11 to 10, motion.
The motion carries ought to pass as amended, carries 11 to 10. And would you like to write the committee report?
Thank you. I didn't catch who seconded the amendment.
Representative Nutter Upham.
Oh, and the bill?
And the bill.
Oh, okay, that's why I
Double
was
hitter.
confused. Okay, thanks. Minority report?
Me. Do people need a break or you want to keep going? Oh, yes. Do you want to have a break or do you want to keep going? Yes.
Keep
going.
They're voting for break.
Okay, let's take about a 10-minute break.
I'm really surprised at how that went.
Did he say?
Oops, sorry.
Do we have any other
All the
bleeding
kids
heart
that-
bills that we
It's
saw?
not always about abused kids, you know. I know the really smart kids whose parents demand they become doctors and they're poets. You know, 16 trying to fight out what college to go to and whatever. I mean, there's lots of reasons kids go to therapy. So.
Well, I still think that kid, I remember how impressed I was with her when she testified.
Oh yeah, yeah.
I mean, she was so desperate. And
My parents never
and it
would
was
let
a
me go
snob.
to.
It was a snobby thing. It wasn't even anything. They just were embarrassed.
I would have thought to go to. I would just kind of. Well, of course, I wouldn't have known where to find a therapist, but my parents wouldn't have let me
It's
go.
not going to happen all that often.
And I don't think we would have got to.
And I think one of the things that hurts us is the original sponsors.
No.
She's a real weirdo.
She made, yeah. Well, I hope she doesn't run again. I think she's not.
I understand that her husband told her that if she's either stays married or gets out.
Yeah, well, she should get out. She's obnoxious. I mean, she's gone off on me. I've never heard the end of the story about that young black man that testified and whatever. You know, she's just. And then she made something on Facebook. You probably aren't on Facebook. She goes, "How about Christians give up hating Jews for Lent?" I'm like, "Fuck that! Don't take down my religion." Sorry for my French, but I was mad.
Not only that, I had the same experience. She came to me way back when she had that first bill with a 12-year-old. And I didn't want to sound too negative.
Yeah, right.
So I said, well, you know, let's think about this. I said, maybe if you made this bill a little more comparable to the Emancipation of Minor bill, it took a little older age, and she just went off on it.
She goes, yeah, if you disagree with her, she goes off
And
on you.
Joe had the same experience, and he even called her up to apologize, see if they could work something out.
No, she's not reasonable to work with, so.
And unfortunately, it spreads a thing with people when they hear this, that all of us that want to do this, I mean, I don't think it hurts if this didn't make it. Because, I mean, we've been doing fine. I would have seen it anyway. I don't give a damn.
It did make it.
I work in.
It did make it.
Yes, I know.
Oh, yeah.
But I said, if
I
it
saw
didn't.
lots of people for free, you know.
Well, you know, I worked at a mental health center. We're mandated to see people.
Oh, yeah. I wasn't. I was trying to turn a profit, which I didn't. But,
Well, and that is a big problem.
no kidding. So, like, I had this one woman came in. Her brother or brother-in-law got deported. The sister-in-law was in prison. Or the other way around, whatever. Yeah, the sister-in-law was in prison. So she took in their child, or two children, and she had three of her own. And she's working a full-time job at Sears. And so she has insurance, so I called the insurance and I said, so how many visits does she have? And they said, oh, unlimited after she makes her deductible. And I'm like, well, what's her deductible? $7,000. This is July, and she's made $1,500.
Sounds reasonable to me.
No.
I'm kidding.
You're terrible. Anyway, so I saw her for. I saw her for free for a bunch of times. You know, I mean, like she's.
Well, anyway, if I don't go to the men's room, I'm going to be in serious trouble.
I have glad tidings. So, any trumpets? Thank you. We are calling this the Shapiro Vacation. And it will run from March 21 to 25. In that there will, yes, in that there is no thing in the big building with the gold dome, and there will be no meetings of this committee. You get the week off.
I would like to give credit to Representative Leon, who first suggested that week to me.
We will, in the spirit of bipartisanship, call it the Shapiro-Leon, or the other amendment is the Leon-Shapiro Vacation Week. And what week is that? 21 to 25 of this very month. Representative Knurk may come in to work if he wishes.
No. Just a question, though, too. Next week, we have potential House sessions Wednesday, Thursday. Are you intending for us to have any committee work next week, or once we finish this, are we done because we're waiting for the Senate bills?
I've changed my mail address to an unlisted number, and therefore no crossover bills have come my way.
Right.
I don't know if anyone out there listening knows of any, but they have not been given to me.
So, long and short, are we not meeting on March 14 and 15?
No committee meetings.
That's what I mean. Okay, so we are not meeting as a committee on March 14 or 15, nor are we meeting on 21 or 22.
Right.
But 15 is one of the days we were asked to hold open. But the other ones are house session days.
Yes, we have house session days. Yeah, that's what I said. Yeah.
See,
yeah.
this is similar to a state mandate versus a federal mandate.
No. I knew we're not having the week off. I was asking about our committee. And then what about the March 28 and 29 for our committee?
We'll see.
Got it. Okay, so at
Just
least
take the win and shut your mic off. Thank you.
got it. No, it's not a worry about a win. Just want to know.
Okay, the last time, March 21 to 25, I now open the exec session on House Bill 1487 relative to the procedure for withdrawing from the vaccine registry. There is a merchant amendment 983, of which I have a whole big stack of, and I'm very happy to share. Coming. Okay, side by.
Okay.
Okay, you should have had a chance to read 1487, and the chair calls on Representative Merchant to explain the amendment side by side with the bill.
Thank you, Mr. Chair. In regards to the language, if you go back to the original bill, under 4, this is on the original bill, not the amendment, under 4, the way it words is different than the amendment, and that's going to be on the line where it says, the general court finds that requirement for a current and former healthcare provider to sign the form. I changed it to read differently, finds that limiting the requirement to a current and healthcare provider, which is what we're talking about. We're limiting the option for the patient. On the bill itself, you're looking at line 12. On the amendment, you're looking at line 5. And where it changes between the words finds that the requirement, which is on line 12 of the bill, was changed on line 5. The court finds that limiting the requirement. So it inserted a word, a single word.
Why?
Because it's limiting the requirement. If we're going to basically at that point in time allow for the options for the patient to opt out, we need to change it to something that's more broad and saying limiting. So it's what happened was the way the original bill was written, the legislative intent was talking about the requirement for a current healthcare provider versus limiting it only to them.
Okay.
It's in my opinion, it was more of a grammatical change. The other part, though, was on the bill itself.
Mhm.
If you go to line 19 and line 20, what it talks about is a healthcare provider, either current or former. And what came up during the conversation was not to limit that, was to allow for the patient to sign the form without the signature of a current healthcare provider. The challenge there is that if we only allow the patient to do it, the Department of Health and Human Services will not know if the signature was actually that of the patient, which is fraud, versus that coming from the patient themselves. So what we talked about, what I came up with was, if you go back to the amendment, on the beginning of line 4, end of line 14, the form shall be signed by a current or former healthcare provider, or the form shall be notarized by an official authorized by a governmental authority to notarize the signature, to prevent the issue of fraud, because that was one of the things that was raised and discussed, was how do I know that the signature on that form is in fact that of the patient? That's why we wanted the provider to sign the form, because if they're signing it, they know the patient signed it. So to avoid the issue of fraud by having it notarized, which a patient can do, they can simply bring it down to a notary and have it signed in front of the notary and submit the form.
Any questions or comments on this? Representative Leon.
Thank you, Mr. Chairman. Thank you for this amendment and looking at these different options. I'm looking at the words in the last line, or the form shall be notarized by an official authorized by a governmental authority to notarize the signature. Is that the way that we normally refer to notaries? Because that seems really confusing to me.
Well, it's the way I wrote it at 10 o'clock last night.
Without a migraine.
Yes,
so good
without a
job.
migraine. So I think it's a little bit more complicated the way I've written it, but I think the intent is pretty clear that it has to be notarized. And I wanted to be sure that someone, this is back not knowing the issue about notarizing a form, that the signature is being notarized, not the form.
Representative Weber?
I was going to just say that I think it may be more words than are necessary, but I think it conveys the meaning that we just want some verification that the person signing the form is not your ex-spouse who's angry at you and has decided to remove all records that you yourself want to keep. And it's a relatively easy way of doing it, and it gets around the problem of those people who don't have their health care provider here, or, or have their health care in Vermont or Maine or whatever it is. I think it's a great way of preserving the original intent while making sure that their fraud is a little less easy.
You just couldn't bring yourself to write notary Republican, could you? Representative Knirk.
Thank you. I once again would like to just check in with the department about something on line 13 in the amendment, and this was actually in the original bill too. request the removal of information from the registry. We heard when we had the previous bill about removal of COVID-19 vaccine information, which came in under the emergency authorization, that this was the only medical record, and those records needed to be retained. Normally, medical records need to be retained for 7 years. In this case, since the provider will have actually given the vaccination, is it a fair assumption that the medical record will still be preserved because the medical record resides in the provider's office? Or will this cause any problem with removing information? Likewise, I guess I would have to say, if this would apply to the COVID-19 where there is no other record, will this be a problem? Could the department clarify that for us?
Would the department like to clarify that? And here they come. 3 of the 2,800 people who work at the department, or 2.
Good afternoon, committee members and Commissioner Pearson. Thank you very much. Anne Marie McCurry from the Department of Health and Human Services, Immunization Section Chief. That is correct. We would be in conflict where if the state of New Hampshire was the provider for COVID-19 vaccination, deleting these records would mean that we would be deleting the only record on file. And therefore, we would be in conflict with maintaining that medical record for 7 years.
Follow up?
Follow up.
May I ask then, can you think of a way to make this workable? Would it just be a matter of saying that it request to remove information from after 7 years? Or, I mean, how do we make this actually work so that it doesn't create a conflict, but still provides what Representative Merchant is trying to do?
I believe that we could handle the forms in a similar way to how we handle the opt-out forms. Those paper records are kept out of the IAS. It's a separate system. They are paper records that are stored in a HIPAA-compliant area.
So, follow up again?
Follow up.
So, in other words, you could live with this because you would remove them from the registry, but you would keep the records. We would just have to make, perhaps that would be something that we'd want to make sure that the population, the public would be aware of, that when this occurs, information would still reside there, so they would, not all information disappears, but the information in the registry would disappear. Is that correct?
That would be correct. Thank you for your question.
Representative Merchant.
Thank you for that. I want to be clear, though, the form we're talking about, it currently is in existence. All we're doing at this point in time is allowing not just only the provider to sign it, but a patient to sign it as long as it's been notarized. So therefore, we're still utilizing the form. The issue we're talking about still exists.
Yes, that is true.
Representative Woods.
Thank you. So just to clarify, in other words, that could be handled in rules with this being removed.
I'm sorry, I can't hear you, sir.
I think he's just trying to clarify. So this is currently done in rules to hold the paper record. So it's already being done, so it's not an issue.
That is correct. That is
Thank you.
administrative rule.
Representative Gay.
Thank you. I guess I'm kind of puzzled if we're trying to remove a record from the registry. How is that removal if you're retaining the record?
Thank you very much for your question. The IAS is a specific system, the immunization registry, that is built to consolidate immunization records so that providers in many different areas could go ahead and access that. If we are removing that record from that database, that system, that record would no longer exist in that system. A paper record would not be in a form that could be shared in any way, shape, or form. It would be basically stored in the event that we needed to retrieve that.
Follow up?
It still sounds, who could access it? I'm not thinking, I'm pushing the envelope to the ultimate. So I'm not thinking a real incident. But if somebody really didn't want their records held anywhere, could they opt that there's no paper record, or you give the paper record to the person who got the immunization, so it was their responsibility to keep it.
Medical providers are required by law to retain a record for 7 years. So just like you would not be able to ask your doctor to delete your record, that record has to be retained. That's a requirement. We would just do it separately outside of the IAS so that we would have that record on file to maintain that compliance with maintaining for 7 years.
Representative Weber.
And just to further beat the dead horse, the purpose of all of this is that information in the registry can be shared under certain limited circumstances, and the information on a piece of paper in a filing cabinet somewhere is not going to be shared, so that somebody who's concerned about their personal information identified being shared is going to have a lot less likelihood of having that happen.
Yes, thank you very much for that clarification.
Representative Cushman.
Thank you, Mr. Chairman. It's just a further clarification for my friend Representative Gay. The only people whose records the department would be holding on to in the event that they ask for it to be withdrawn, it would be somewhere separate from the registry, would be those who received immunization from the state.
That is correct.
Yeah, just for further clarification, it was under Emergency Order 76, and it was the COVID-19 vaccine only.
Any further questions on the amendments?
Can I call the question?
Well, technically you can. I believe your statement should read, may you
May
call
I?
the question. Yes, you may. We haven't actually done that yet. So we need to make a motion for you to call it.
No.
You don't?
Committee procedure is informal, and we do not have calling the question in committee.
No.
Speak to your caucus. And I'll listen in.
I'm trying.
No comment. Would somebody please make a sensible, wonderful motion here?
I'll make the motion.
Merchant. All right, Merchant and Lay on 2022-0983. And if we were less formal, your suggestion would be taken, but we're going to do it anyway. So will the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Sorry. Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21 to 0, pass.
Now the chair will entertain a second motion. And remember, you get to write the blurb. I shouldn't have said that. Now nobody will do
Nobody's
it.
going to move it.
We could assign could we assign somebody? I suppose we could.
Representative Cushman?
Would you waive who somebody in someone just spoke?
She's just waving over there. Oh,
Hi. Oh, what? Oh, you want to do it?
Thanks.
You do have a good literary style.
Yes, she does.
Okay.
Did you go write my blurbs?
Representative Cushman did, but I would like to have a Democrat.
Second.
Seconded.
Lucy or who?
Does one of you yield to the other, or? Merchant. All right, so we have before us the motion ought to pass as amended on House Bill 1487 as amended by 2022-0983, moved by Representative Cushman, seconded by Representative Merchant. And would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
21 to 0 consent.
You know what that means? It could go on consent unless there's objection.
No
And I
objection.
see none. So Representative Cushman, among your other duties. Thank you. And for the record, I should have done this before. There were 262 signups in favor of this bill, original bill, and 49 against. This ends the exec session on House Bill 1487.
She's trying to decide if we need a bill writer to stay here.
Do you have a bill, do you need a bill writer or something? Talk to her. We're not going to go past 5. No, I'm going to throw them all out.
Okay, great.
Good. Open the hearing on House Bill 1345 relative to the release of a teenager's medical records to a parent or guardian, prime sponsor, Representative Gay. And there is an amendment to this that I have. There's Amendment 668. And some are going this way, and some are going that way. And another one's going this way.
It's coming.
It's
Coming.
1345.
Amendments are coming, 668.
You may already have copies because I passed them out like 2 weeks ago.
Well. And for the record, 26 people signed in favor of this bill and 3 against.
Lucy?
Thank you.
Excuse me. 1480s. Before we continue, I'm going to ask everyone for a moment of silence to honor the memory of the late Rennie Cushing. Thank you, everyone. Representative Gay, would you wish to speak to your amendment, please,
could
on
I
House?
have-
Yes, ma'am.
could I just ask to see the Democrats across the hall when we're done? Thank you.
Would you introduce your amendment, please?
I move that we adopt Amendment 0668
Okay.
for House Bill 1345.
And do we have a second? All right, Representative Kelsey. Now, Representative Gay, please speak to your amendment 668.
The amendment was necessary because we needed to clarify that we still had to accommodate federal requirements that restrict, there are a few restrictions right now for on release of a minor, a 13-year-old and above, to release their records to their parents, which accidentally, I think, got passed when they were trying to protect certain records of a teenager. They kind of overstepped and just said a parent had no access to their teenager's records unless the child wrote them a release, which is extremely burdensome to parents, and I would expect to providers to keep those records. But you have to accommodate the fact that there are federal requirements, and there is a specific New Hampshire law prohibiting just releasing a certain type of treatment. So that has to be, that I had to put that back in the bill. So that's why what was added was line 8 in the amendment, as directed by federal or specific state law.
Any comments or questions? Representative Merchant.
I want to say thank you to Representative Gay for making the clarification, because I think this does clarify a lot of things. And what it really comes down to is that if there is a federal or specific state law, we have to honor that for multiple reasons. So therefore, by adding those words into your amendment, I think it clarifies it immensely.
Thank you. Oh, shall I make the motion now?
The motion, you made the motion
Oh, okay.
already.
I'll second it.
You made, no, it's already been seconded. So I know we're eager. The amendment 0668 to House Bill 1345, the motion was ought to pass. It was moved by Representative Gay. It was seconded by Representative Kelsey. And when the clerk is ready, please call the roll.
Representative Leon.
Yes.
Representative McMahon.
Yes.
Representative Acton.
Yes.
Representative Gay.
Yes.
Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow. Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes, 21-0. The chair calls on Representative Gay for a follow-up motion. As amended by 668, that has been moved by Representative Gay. Is Representative Weber? Any further discussion? The motion before us is House Bill 1345, as amended by Amendment 2022-0668H. The motion is ought to pass as amended. It was moved by Representative Gay and seconded by Representative Weber. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas. Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Query.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
Carries 21 to 0.
I don't sense anybody is objecting to this to go on to consent. And this means, Representative Gay, you get to write the committee report. Cool. They raise them tough down in Houston, don't they? Representative Knirk.
Just a thing regarding Rennie Cushing. We did get an email, and they asked that we would not discuss his death online until an official statement has been released, and that would not be until at least this evening. So we can talk about it here, but nothing online, please. Yeah. I have no idea, but many people prefer not to do that. Yeah.
I would suggest that we wait and find out what the family's wishes are, because they might have an alternative suggestion. But I think it's a very kind and welcome gesture of some sort. Thank you.
This actually now closes the executive session officially on House Bill 1345. I would like to reopen the discussion on 1044 that we had looked at before. The ruling of the Speaker is the amendment to this is non-germane. It has been requested that there be a hearing on this. The calendar doesn't allow it. I will not do that. The question is for later, and my suggestion to the prime sponsor of, well, actually the prime sponsor, no, the sponsor of the amendment, is that you work with the Senate committee on whatever bill is closest to this, and then you will come up with, if you choose, an amendment that is close enough that it doesn't have to be ruled non-germane. That makes life easier. So I would say talk to the Senate counterparts, find out what they've got, and when we take bills on crossover, that's when we'll do this.
Well, I do have an amendment here for us to send over to the Senate in the hopes that if we find we do need to make those non-germane changes, we can take that up in a Senate committee later.
All right, I've just received this amendment. Representative Weber?
I think that's answered my question. I was going to ask what you were proposing to do with the bill in the interim, but if we're going to look at a different amendment, we can proceed to a different amendment.
We can, and take a look at it, and those of you who are really wise at this sort of thing, see how close it looks, because if it is not close, we have to have another ruling on the germaneness of the amendment. My guess is that Representative Cushman, being a good writer, has probably presented us with something that is germane.
Thank you, Mr. Chairman. I did speak to Speaker Packard, and the issue were the 2 additional sections of that bill that had to do with the Patient Bill of Rights. I mean, with that amendment that had to do with the Patient Bill of Rights. So this is just an amendment to the first part of the bill. It looks very much more like the original bill. It just adds the words operates on a membership-based business model.
Representative Weber.
I appreciate the clarification. I certainly appreciate the removal of the non-germane portion, and this certainly is simply a modification of the original bill. I'm still against it for all the reasons we said earlier, and I'm not going to bother to repeat them because you've heard them all before. Thank you.
And I completely agree, and for the sake of brevity, I would move that we adopt Amendment 2022-0991H to House Bill 1044.
1 second, please. Hold that thought. Choking in the paperwork here momentarily. Okay, Amendment 991, moved by Cushman. And Representative Kofalt seconds this amendment. Now further discussion. Representative Knurk.
I will oppose the amendment for the same reason that I continue to oppose the bill, and that is that this is highly likely to bankrupt our critical access hospitals who, if they lose even just a small portion of their private payer or insured, well, actually it's not insured, private payer, in other words, those who can pay, if they leave, they will not be able to stay afloat, and they're going to have to cut services. And for those of us in rural areas, the emergency services, maternity services are critical to our area because you don't have a lot of time necessarily to go driving off to a hospital 100 miles away to have your baby or to get taken care of when you get run over by a car. It does create also a two-tiered healthcare system, those who can pay, and then the rest of the people. It's not even that they're going to get secondary care, but they're likely to receive potentially no care. Because if you cannot stay afloat as a critical access hospital by losing your revenue, the services will be gone. And again, we have seen that particularly with the closure of some maternity services in the state when they've just not been able to keep in the black, they're in the red chronically, and they have to cut services that lose money. And this is a real problem to our providing health care, particularly in our rural areas. So I think it has, I'm not sure if I want to call them unintended, maybe they're intended, but they have clear unintended consequences of denying health care to a large swath of people.
Chair has two thoughts. One, as you know, my wife and I run a family practice medicine / counseling / massage facility in Kingston, and we are very much an alternative to what we all agree is kind of a messed up system. So my thought is there can be a variety of ways to put different models in place. This isn't the only option we have. It isn't what's in this bill versus everything else. There are other models. There can be many more. My second thought is I lived in England for 3 years, and there were private pay hospitals. And the local hospitals were not impoverished by there being private pay because you had complete government-funded, socialized medicine. So if you want to put up private pay hospitals and skim up the cream, be prepared that the next step will be complete European-style socialized medicine. And if you don't want that, then perhaps you don't want to bankrupt the local hospitals that exist. So there's my thoughts. Representative Gay.
If I'm not wrong, it seems like a real serious problem is that our Medicare doesn't pay sufficiently for the services. And that seems to be, it's being propped up by people paying who are insured. So it seems like that's an issue we really need to work on. I don't know any of it. Could ask you a million questions right now about what's the percentage that we get reimbursed by the federal government. Are we restricted by the federal government on what we can charge? Things like that. It just seems like that is such a serious issue that it's at the basis of all our costs.
Representative Leon.
Thank you, Mr. Chairman. I do appreciate that some areas don't have a very robust healthcare market, even when there is just the hospital and the critical access hospital. When you're looking at people who are would be creating these facilities on the direct pay or membership-based model, they're going to need a larger field to draw from than the North Country or these other areas that are served by the critical access hospitals. I really only see the possibility of this being viable in the highly populated areas in the southern part of the state at this point. And by doing that and having a option, I don't see them getting very large. I don't see a giant competition for our established system because a lot of people do enjoy having their insurance coverage. But having an option to do this, and instead of your insurance company being the ultimate client of the healthcare system, when you're paying, you're the one who's paying, and it changes the dynamic. So I'd like to see us have a chance to offer these facilities here in New Hampshire. I think it'd be niche. I think it'd be small. That's what keeps the New Zealand system afloat. I've spoken with surgeons there. They have a socialized medicine. If they didn't have those, they wouldn't have a chance. So I want to see this have a chance to take root here in New Hampshire.
Representative Knurk.
But you just made the important point. They have socialized medicine. We do not. When we do not, this will be a problem. And so Representative Pearson made the Chair Pearson made the comment. If we did have a system like England, and Norway also has the same thing, then it works fine to have these private things because everybody has coverage, and the coverage actually pays because they invest in it. The problem with us is we do not put enough money into Medicare or Medicaid. That is the problem. But to quote President Trump, who knew healthcare was complex? It is complex, and it's not a problem we're going to fix here today. But the bottom line is, the comment you made at the end there was exactly right. They have socialized medicine. We do not.
Representative Leon.
Thank you, Mr. Chairman. We also have a system that subsidizes healthcare throughout the whole world through the privately insured Americans, and we have lots of big issues. I see this as a small and niche if it does take root, but we probably should stop talking, start voting. Thank you.
Seeing nothing further, the matter before us is the Amendment 0991 as moved by Representative Cushman and seconded by Representative Kofalt. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Yes. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Yes. Representative Weber. Yes. I gotcha. Representative Freitas. No. Representative Snow.
No.
Representative Knurk.
No.
Representative Query.
No.
Representative Cannon.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
No.
Representative Pearson.
No.
11-10.
The motion fails. Representative Knurk.
I move ITL.
The motion on the bill is ITL. Representative Knurk, do I have a second? Representative Weber. Any further discussion? Seeing none, the motion before us is an expedient to legislate on House Bill 1044, moved by Representative Knurk and seconded by Representative Weber. And would the clerk please call the roll?
Representative Leon.
No.
Representative McMahon.
Yes.
Representative Acton.
Yes.
Representative Gay. Representative Cushman?
No.
Representative Folsom, no. Representative Kelsey?
No.
Representative King?
Yes.
Representative Kofalt?
No.
Representative DeLamus? Representative Weber? Representative Freitas?
Yes.
Representative Snow?
Yes.
Representative Knirk?
Yes.
Representative Query?
Yes.
Representative Cannon?
Yes.
Representative Nutter Upham?
Yes.
Representative Shapiro? Representative Woods?
Yes.
Representative Merchant?
Yes.
Representative Pearson?
Yes.
14 to 7.
The motion inexpedient to legislate carries 14 to 7. Who will write the committee report? Representative Knirk will write the committee report. Who would like to write the minority report? Representative Cushman. Thank you so much. This concludes the hearing on House Bill 1044. And for the last item to be taken up today, the relative bill, I open the exec session on House Bill 1347, which is very similar in many ways. And there is an amendment that Representative Cushman is handing out.
And this is the last one of
That's the last one I'm going to do tonight. Most of the rest of them. Representative Cushman, the amendment you just handed out, 996, does this replace 937 that you had previously done?
Yes, it does.
Okay, thank you. And we'll give people a few minutes to read the amendment that has just been created. Sure, we got a whole bunch of them. We got county ones, we got a lot of private ones.
So what would this?
I don't know, raise the question.
Oh, they're only cash.
Representative Cushman, would you introduce your amendment to us, please?
Yes, thank you. Before you have
Come on, guys.
Amendment 0996H. So the last bill we heard was the whole enchilada. This is just a small bite. I limited my original bill to only apply to nursing homes and rehabs. So, and as I discussed in the hearing for this bill, we did need to remove the moratorium on new facilities. That was discussed during the hearing. So what you have is the removal of that moratorium for new nursing homes and rehabs if they operate on a membership-based business model or exclusively provide services to persons who make direct payment. And in section 2, it exempts these facilities in paragraph 2 of that section. Only nursing homes, again, intermediate care and rehabs that operate on this. So it exempts them from 1A and 1B. So they shall not be required to accept all forms of payment, and they shall not be required to have the assistance plan for people who are uninsured. Now, I don't think we're going to have the same argument about critical care hospitals closing when this is only nursing homes and rehabs. So I hope that that barrier being removed, that we can come to an agreement, you know, that this is a good option for people if they want to pay, have a different way to pay for nursing care, that private facilities should be able to operate in New Hampshire.
Representative Knurk.
In our county nursing homes and in many other nursing homes, the primary provider of payment is Medicaid. That is how they get their reimbursement. We are just going through our budgetary process in Carroll County right now, and the majority of our income comes from Medicaid. We have a small amount from private pay, but that small number of private pay people is very important for us. I would still make precisely the same argument, and that is that if you skim off those private pay people into another facility, our county nursing homes will not be able to function. Or, well, actually, they'll be able to function as long as we increase our property tax rate immensely. And that's precisely the outcome, because let us say that you get 60% of your income from Medicaid and you get 40% from private pay, and let's say you only lose a small amount, but you lose, let's say, 10%, and for, I don't remember the exact number in ours, but I think ours is about $17 million, and because we're a small one. And so I could do the math, but I'm not going to worry about the calculation, but it's a few $1 million that is going to increase the property tax rate immensely. So if you are prepared to increase the property tax rate in your county, this is a wonderful bill. If not, if you're not prepared for that, we should not pass this bill. And that's only the county nursing homes. Any other nursing homes who are trying to survive will also then go bankrupt, so the various private nursing homes would not be able to afford to stay in business.
Representative Snow.
I'm looking at line 10 of the amendment, and that says no new license shall be issued for, and there shall be no increase in license capacity of any nursing home, blah, 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 and the other services, unless that person is one of these membership only or pay. Does this go back? Does this bring the certificate of need process back, so you can't expand or develop a new nursing home unless you go before some government board to be approved? That's what it sounds like.
That is the remainder of the certificate of need law that you read. The only part that I'm adding is what's in bold. What you first read on line 10 is what is currently in law, and that was the leftover pieces after the certificate of need board was removed. One of the conditions of that negotiation was to leave in law that there's a moratorium on new or expanding medical facilities, nursing homes and rehabs.
And why wouldn't we, if we're going to remove that restriction on existing nursing homes and rehab facilities and only grant it to the membership only and private pay, why wouldn't we remove it for everybody? Why do we only give these people an advantage over all the existing nursing homes currently in existence?
Well, unfortunately, there was a lot of pushback on efforts to remove the moratorium for anybody, and we're trying to set up an alternative option for people.
But you're giving them a distinct advantage by saying they're not subject to the remaining certificate of need process. So they can blow it up as much as they want, and everybody else can't.
I find it very ironic that you're talking about having this advantage when this entire conversation on this bill and the last was resistance to removing protectionism from our highly advantaged facilities that currently exist. This is to open up the market and provide options. Currently, those facilities that exist now are protected by laws that ensure there is no competition against them. So this is not, it's removing a disadvantage for other
it adds another
facilities.
disadvantage in terms of these private facilities that are private pay. Doesn't seem fair to me.
Thank you, Representative. Representative Knurk. Representative Merchant.
My understanding is this already exists. So I don't know why we need the law. I'll give you an example, and I'll need to confirm this because I didn't have a chance to do this. I could do this probably overnight to be sure about this, my facts. But there are places like Kendall, Hanover, which is a private community. And therefore, you cannot get into Kendall unless you have the wealth and the means to do it. And they also have a nursing home was built into it. I don't believe that the nursing home they operate has to come under the moratorium of the state because it's privately funded. So I commend you for what you're doing, Representative Cushman, but I believe that already exists in the market today. There are places that people who have the wealth can go without having to worry about the market because the market's already taking care of it. That's in my opinion. Again, I can call somebody this evening who I know there to confirm that, in fact, places like Kendall, which are called a residential continuum care community, are in fact private, and they don't take Medicare.
So a residential continuing care community is typically like an assisted living. and
No,
that-
it goes from, you have on the facility, okay, you go from independent living to assisted living to nursing home, all in one community. But you have to buy into it, you have to pay for it. There's no subsidization coming from outside sources. They will occasionally bill from Medicare if they're able to, but it's not required. You don't have to have it.
So I just don't understand how that's legal. Plus, we heard from the department before when we were having the conversation on this bill that it was confirmed you can't have a nursing home or a rehab that doesn't take all payers because they fall under this statute 151:2 that governs the licensure for these facilities. So they can't obtain a license unless they accept all payers. They fall under that.
Representative Weber.
I'm loath to put Mr. Williams on the spot, but
I was about to, so you take the hit.
I'm going to say that Kendall at Hanover exists, Rivermead and Peterborough exists. I'm hearing behind me that a new community just opened in Keene, so there are two in Nashua. There are private pay communities that are a continuum of care all over the state. And so I'm hoping against hope that they're not all illegal and all of their residents aren't about to be turfed out. And I'm hoping that Mr. Williams can explain that to us.
Thank you so much.
Yes.
Yes, the issue of the continuing care community residential centers, otherwise known as the CCRCs. CCRCs have been in existence, and you've got a very good description of how they operate because they are a continuum of care, everything from, from a basic living to moving to assisted living into acute nursing facility care. There was legislation brought up within about the last 8 years or so dealing with the overlapping authority between the Department of Health and Human Services and that of the Insurance Department, because we do license the facilities portion of it, but in terms of how that they operate, they fall under the insurance statute. So if you want legislation for next year to look at, this is a issue that has been looked at in the past but never resulted in clarifying legislation between the duties of the Department of Health and Services and that of the CCRCs. To my knowledge, the CCCR, whatever it is, are perfectly fine, but there is that anomaly of needing to look at that issue. If you research bills that were filed by then Senator Andy Sanborn, I know this was a very important issue to him because he charged me on a late day, I'm sure, like this, to looking into this and to get a meeting together with representatives from the Insurance Department to try to see what we can do to vet that. Far scope from, I'm sure, the questions here today, but I hope that was responsive to your questions at 4:35 in the afternoon.
Don't tell him that. Mr. Williams, the bill is about a private pay nursing home. The answers I'm hearing are about continuum of care. The question remains, is there any legal private only nursing home, not continuum of care, in the state of New Hampshire?
Okay. I can confirm that. I believe, working with Attorney John Martin, who used to oversee those facilities, but has not done so for a few years. When I talked with him, and again, this is point-in-time information, around 3 or 4 years ago, that I believe there was one private facility out towards, I want to say, the Stratford County area of the state. If I'm pretty sure meeting your definition. But otherwise, I'd have to really go back and to identify where we are at a point in time now. That is dated information.
Okay, thank you. Representative Shapiro.
Yes, thank you, Mr. Chairman. I want to go back to when Representative Gay was talking about Medicare and Medicaid not paying adequately, which is maybe the foundational cause for some of these problems. And I wholeheartedly agree. And we in New Hampshire don't have any ability to affect Medicare rates, but we absolutely have the ability to affect Medicaid rates. So I hope that we can collaborate on a bill to raise Medicaid rates next year. One of my concerns with this bill is that it potentially creates a two-tier system of care, and I think we already have a two-tier system of care. Hillside Village is a continuing care facility that opened in Keene a few years ago, and you have to be wealthy or upper middle class to be able to afford to go there. The county nursing home, which in Cheshire County is excellent, is where all the people who don't have money or who run out of money and have to rely on Medicaid. So we already have, to some degree, a two-tier system of care, but I think this would just increase that, and I'm not in favor of increasing that, so I would vote against this bill.
Representative Weber.
And just to carry that reasoning along a little bit further, no, this is not going to affect the critical care access hospitals, but it certainly affects the county nursing homes. And if you go to your county delegation meeting every year, the population of the county nursing home is sicker, heavier, they need more bariatric beds, they need more services, because the county nursing home is the nursing home of last resort. So if you don't have the resources to go anywhere else, and if you're a management issue, so nobody else wants to take you, you go to the county nursing home. And different counties have different experience. I keep hearing that Hillsborough County Nursing Home actually makes a profit, which is astounding to those of us from Cheshire County. But we have an excellent nursing home, which is the nursing home of last resort, but that's done on the back of the taxpayers. So if you, once again, if you skim off the paying patients, your property tax rates are going to go up.
As one of the members of the county delegation for Rockingham County that's charged with knowing the nursing home situation, I would second what Representative Weber just said. Representative Woods.
Thank you. I'm chair of the Merrimack County Nursing Home Budget Committee. One of the
Don't go far, Mr. Williams.
One of the other things that's not been mentioned is the domino effect, is the fact that one of the serious problems of being able to keep a census up so you can have income is personnel. And with competing with the paid, those nurses will go there, therefore they won't be able to go to the county nursing home, and that further exacerbates the problem when you have the domino effect. If you don't have the personnel, you can't keep the census, and therefore we go farther down. So there is that dimension that comes into play.
Representative Knirk.
I've already explained why I oppose the bill and the amendment in general, but I would also like to bring up that I think this amendment also has a feature in it which is rather non-germane, because what the first section is doing is changing the issues about the certificate of need. It's modifying that. We did not have a hearing on that issue. That was not part of the original bill. And as a result, I think we would be doing a disservice to the public and to the various nursing homes and everybody else to consider this amendment and pass it, or even not pass it, without having a proper public hearing. And I don't think we should have a public hearing. I think this amendment should be turned back.
Representative Cushman.
Thank you, Mr. Chairman. I had mentioned this piece as being integral to that bill in my introduction of the bill during the hearing, and everyone who was there had an opportunity to comment on that. That I made it very clear that I wanted the moratorium lifted, or I felt that the bill probably wouldn't work. But on this topic of, like, we're all admitting here that there's a problem. I think that it originated with Medicare and Medicaid in the beginning, and insurance. I mean, these things take away from the care being the product, and instead you're purchasing discounts on the cost of care. So it's not transparent. We're not paying for what we're getting. We're paying for an intermediary, a third party. And I definitely don't agree that a one-payer system is the way to deal with that. I think we need market competition, and we need plenty of options, and, you know, to meet the demand. And I think that if these alternative options become available, adoption will be slow. And if it proves that that it offers better services at a lower cost and makes it affordable for people, then there's no harm in eventually those outdated systems, fading out, and these new systems taking over and, offering people a better product. So,
Representative Cushman, I thought I heard you say, please clarify in case I got it wrong, this new amendment we're looking at, did you run this by the speaker?
I did not run it specifically by him, but I told him, we talked about what was in the other bill, and the Patient Bill of Rights was all of that language was the main issue.
Okay, so you did talk about the amendments that were ruled non-germane.
Yes.
Along the way to coming up with something that would pass muster.
Yes.
I'm hearing you say.
Yes.
Okay, thank you. Representative Weber.
I'm just going to suggest to everybody that we are not going to solve the problems of the healthcare industry in the state in the state of New Hampshire or the United States. And we only have one small piece in front of us, and perhaps it might be time to vote on that.
I was hoping to solve the healthcare crisis. Another day. Tomorrow. Representative Cushman, would you care to make a motion?
I'm going to motion that we adopt the amendment 2022-0996H to House Bill 1347.
Is there a second on this amendment? Representative Kofalt, thank you very much. Any further discussion before we vote? Representative Gay.
Under this amendment, if a person has the money to go into a private pay and runs out of money, what happens to that person? My mother was in a private pay that accepted Medicaid. So when she ran out of money, she switched over to Medicaid. But it was private. It was the Jewish nursing home in Houston, which is very high quality. But I'm trying to understand how that compares to this.
Representative Weber.
So in the county nursing home, you pay until you qualify for Medicaid, and then Medicaid takes over. And many other nursing homes have that policy as well, but I have been told by our administrator that there are nursing homes that when you run out of money, then they come to the county nursing home because there isn't anywhere else for them to go. So because this is a private pay model and a membership model, unless there is some kind of prearranged agreement that somebody's going to keep people forever, when they run out of money, they're going to come to the county nursing home on Medicaid.
Representative Knirk.
In other words, they'll be kicked out of the nursing home that they're in.
Mm-hmm.
Is that true, Leah?
Yeah, that's true.
Well, I suppose it depends on the policy. There's nothing in here that says they can't have a charity care, or that the membership wouldn't be a lifelong thing that you pay into, so you pay for your entire care ahead of time. I think that the business model is up to the entrepreneurs who want to start the business, and there are options to deal with that. And people are creative when they're starting businesses, and people who start these businesses want to help people generally.
But
one option is when the patient runs out of money, you got to go. There's only so many charity cases an organization can have. I think of my mom, who was in one in Massachusetts, and there was only so many that they could carry. There were models where you sign over all of your property to the nursing home, and they might say, okay, we now own a $300,000 house, and we'll make a deal how many years that'll get you. But still, they have to run a business. Even if they allow themselves a low profit margin, they have to run themselves a business. And when people stop paying, they can only take so many of those. Representative Merchant.
I think basically you hit the nail on the head. When you deal with the continuing care retirement community, in order to be part of it, to ensure from a business model, the organization does not go bankrupt, you have to front load it. I know some of them are charging anywhere from $750,000 to $1 million entrance fees to guarantee that there's enough money for them to take care of you for the rest of your life. On top of that, you have to also pay monthly fees. So I'm going to go back and said before, this business model exists today. There's no need for this bill because it does already exist in the state of New Hampshire. Those who have the means and have the funds can acquire that level of care and to be taken care of from the day they move in to the day they move out. So therefore, I don't think the bill really needs to be addressed or passed because we already have the free market working the way it should.
Seeing no further discussion, the question before us is Amendment 0996H to House Bill 1347, moved by Representative Cushman and seconded by Representative Kofalt. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Representative Weber. Representative Freitas.
No.
Representative Snow. Representative Knirk.
No.
Representative Query.
No.
Representative Cannon.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
No.
Representative Pearson.
Yes.
Carries 11 to 10.
The chair will now entertain a second motion.
Thank you, Mr. Chairman. My second motion is that we vote ought to pass on House Bill 1347 as amended by Amendment 2022-0996H.
And do I hear a second? Representative Kofalt. Discussion. For me, the tiebreaker was if this already exists, putting it into law again won't do any difference. So what the heck? If it's already there,
Okay, well,
that's my thought. Representative Knirk.
yes, but that has to do with these facilities that are the nursing facilities and such that are continuing care. We still have our county nursing homes and other nursing homes that are not in that. The rest of the amendment and actually the original bill does refer to all of that. And so we still are going to have the problem that if we're going to do this, we should have an amendment to help out the counties with backfilling the downshifting we're going to do to them for property tax, because it will still be a problem. So yes, I agree, there are these continuing care communities that can pull that off for a continuum of care, but most people are not doing that. Most people are going to the county nursing home, where, again, as Representative Weber said, they're going to be private paid till they spend down their assets, then they become Medicare, and we then have to pay for them with Medicaid funds. And if they're in one of these other private places, they could just get the boot unless they're in a continuing care thing and have given that front end loading. So we still are going to see our property taxes rise, perhaps substantially, to be able to maintain our county nursing homes.
We just opened a big facility in Kingston that is private pay, and oh my gosh, is it upscale. And since one of my jobs in the county delegation is to look after the nursing homes, that was my immediate thought. As of yet, and this other facility's now been open for 3 years, we have not seen a financial impact on our county nursing home. I'm not saying that won't happen in a year or 2 or 3 or 4, but it has not happened yet. Seeing no further discussion, the matter before us is House Bill 1347 as amended by Amendment 2022-0996H, moved by Representative Cushman, seconded by Representative Kofalt. Would the clerk please call the roll?
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton.
Yes.
Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey.
Yes.
Representative King.
Yes.
Representative Kofalt.
Yes.
Representative DeLamus. Yes. Representative Weber. Representative Freitas.
No.
Representative Snow.
No.
Representative Knirk.
No.
Representative Query.
No.
Representative Cannon.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
12 to 9, it passes.
And the bill as amended carries 12 to 9. Just a few things as we wrap it up here. As many blurbs as you can send me. I am going from here to my office, where I will stay for I don't know how long. I do have a TV there, and the NCIS has a new episode at 9 o'clock.
I'd be glad to do the minority report on that, and for the
I'm
clerk.
sorry.
Yes, I think that's important. For the clerk, the
terribly
minority
sorry.
report and minority motion would be ITL.
Okay, thank you.
You're welcome.
So the blurb will be Cushman for the committee, and Knirk for the minority. And this closes the hearing on 1347. Sorry for jumping the gun. Just a reminder, we are meeting tomorrow, but not here. We have been relegated to rooms 201-3. Just also a reminder, if you haven't jotted it down, we have the Leon Shapiro Vacation Week of March 21 to 5. And Representative Weber has asked for a meeting of the Democrats afterwards. Representative Shapiro?
When is the outside date for having the reports in?
I have to have them in noonish on Wednesday. So I have to have them from you before-ish. Okay,
you.
this closes the meeting. Drive carefully.